Dr. Akran, just confirming you're still there.
I am here. I am here.
Oh, okay. Right. I couldn't see you on my screen. I thought you disappeared.
No, I'm here. I'm here. My camera is on and my mic is on. Everything's working.
Okay.
Ready to go.
Yeah, just one more minute or so. I think people are coming in. We're now at 30. So a minute or two, I'm sure we should be well over 30. Yeah, right. I think that is good. Okay. All right. Good afternoon again, everyone, and good evening, and welcome to this SASOM National webinar. And the theme of this webinar is Occupational Health of Informal and Migrant Workers. It is organized by and hosted by the National Office of the South African Society of Occupational Medicine. And this is in collaboration with the Global Coalition for Informal Workers Health, Safety and Wellbeing, GCIW, and the International Ergonomics and Human Factors Association, IEA, Technical Committee on Informal Work. So my name is Dr. Itumeleng Tatamala. I'm one of the executive members of SASOM, which is the SA Society of Occupational Medicine. So today we've got a very exciting lineup of talks and panels that has been arranged. The first panel will be moderated by Dr. Akran, focusing on occupational health of informal workers and looking at what are the drivers, the new forms of work and OHS challenges. And this will be up to around 4 o'clock. And thereafter, my colleague, Dr. Jeffrey Dalbana, will come through and will introduce the second part of the session, which will then focus on community engagement and collective actions as well. So you're welcome throughout the session to please post your questions in the Q&A, or you may also send us direct messages as well. So just as a form of a very quick introduction of our first moderator, so Dr. Akran Salman Navarro. So Dr. Akran is a physician who's trained in occupational medicine and has a graduate degree in ergonomics and biomechanics and a postdoctoral fellowship in population health and healthcare delivery from delivery science from New York University. He is affiliated with New York University, Boston School of Medicine, and has many other affiliations, academic affiliations globally as well. His focus is on promoting occupational health to vulnerable working population via a multiple global intervention, and recently through the New York City Health and Hospital, which is the largest public health system in the USA. He also is more recently one of the leaders spearheading the establishment of the Global Coalition for Informal Workers' Health, Safety, and Well-being. So thank you so much. Over to you.
Thank you, Dr. Tatamala, and welcome everybody. First, I want to thank the South African Society for Occupational Medicine for this webinar too that we are hosting. And like it was mentioned before, we're doing this webinar in collaboration with the Global Coalition of Informal Work, the International Ergonomic and Human Factors Association, Technical Committee of Informal Work, and many folks here from other very important organizations such as ICO, the International Commission on Occupational Health, and WIGO, among others. I'll be moderating the first panel. My colleague Maggie Graff will be moderating the second panel. For now, we have, like mentioned before, a great group of colleagues. It's an honor to work with our first speakers. We're gonna kick it off with Dr. Mahinda Seneviratne. Then, after his presentation, we're going to pass through Professor Andrew Thatcher, and then we're going to finish up this first panel with Mr. Matthew Oloda. Without further ado, I'm going to first introduce the first speaker, and we'll leave the Q&As for the end. You're welcome to write your questions in the Q&A option of the Zoom, and we can address them at the end. So it is my great pleasure to introduce our first speaker, longtime colleague and friend, Dr. Mahinda Seneviratne. Dr. Mahinda holds a master's degree in occupational health and safety from the University of New South Wales in Australia, and is a certified occupational hygienist. His capacity of World Health Strategist, he's currently the State Inspector for Occupational Health and Environmental at Safe Work, Australia, in New South Wales, with prior roles as research scientist at the Australian National Occupational Health and Safety Commission, and Senior Occupational Health and Safety Advisor for the Workers' Health Centre at Grenville, Australia. A fellow of the Australian Institute of Occupational Hygienists and a board member of the International Commission of Occupational Health, Mahinda has led significant initiatives, including Ghana's first occupational hygiene workshop in 2011 to build occupational hygiene capabilities in small enterprise, as well as Australia's implementation of the globally harmonized system for classifications and labeling on hazard chemicals, and also investigations on silicosis cases among engineered stone manufacturers and installers that led to a landmark legal action in Australia in 2024. Mahinda is also chaired the ICO Scientific Committee on Occupational Health in Small-Scale Enterprise and Informal Sector for 2 terms from 2018 and 2024. It is a great pleasure to hand it to Dr. Mahinda, and I'll leave the floor to you.
Thank you very much, Akran. And it's a very good late evening from me here from Darug country here in Eastern Australia. And first, it's a great privilege to be speaking at this SESOM webinar. And I want to first thank Claudina Noguera for the warm invitation she gave me to speak at this webinar. So this is a topic of great global significance in occupational health, with giving attention to both informal and migrant workers. So next slide, please. So in kicking off this webinar, I want to focus on 3 areas in my presentation. The previous one, yeah. The 3 areas I want to focus as the first presentation is first to take a brief overview on informal workers and their occupational health, the specific challenges, and then to share some initiatives that were taken by ICO to address the health at work of informal workers. And finally, I want to suggest some pathways that we could discuss today in this webinar on how to progress by working together as coalitions and collaborators in dealing with occupational health of informal workers. Next slide, please. So occupational health of informal workers is, if not one, it is, I believe, one of the greatest challenges that is facing the global occupational health community, the professional community. As we can see here, informal workers are a large component in the workforce in many countries. And especially, as you can see here, countries in Africa where the informal workers consist as much as 90% or more, and also in large parts of Asia and also Central and Latin America. They play a very important role in the national economies in countries and make a large contribution to it. But their role is often largely ignored, and informal workers are often marginalized in policy making and strategies for priority programs in nations. Next slide, please. Just to show you some of the sort of hazardous work that uniquely faced by informal workers. Now, many of us as occupational health professionals are familiar dealing with the usual hazards of chemicals, dust, noise, and such in most industrial settings. But as this selection of informal workers from Sri Lanka that I have engaged with recently shows, informal workers can face very unique hazards in their work. And as you can see from the tree lopper, he not only works at very high heights, but he also takes a very sharp, heavy axe to the top of the trees to work with that. The construction worker is quite skilled, but in his work, he has to carry cement bags which weigh over 50 kilograms regularly. And then they work with the cement without adequate shoes or hand protection and end up with contact dermatitis, which they need to deal with daily and get back to work. Then you get the old fishermen who have been fishing all their lives. Their work involves, as you know, fisheries is one of the most hazardous occupations, and this involves work in deep seas over long periods of time, often till late at night. And the two women in the lower photo are seaweed harvesters in the northern parts of Sri Lanka. And one of the unique challenges they have is that they don't have culturally appropriate wet work gear that they can use to work in water for long hours. So as you can see, informal workers have very different and unique hazards that they face that are a challenge for those dealing with occupational health. And all these workers in parts of Asia and Africa, as you know, close to the equator, work long hours in very high heat. And with climate change, this is a great challenge for them, heat stress. And the ICO held a special symposium last month at the Expo 25 Global Health event, where we looked at ICO colleagues who are doing a lot of work on climate change and heat stress on workers, looked at some of the state-of-the-art research and information, some of the resources available on hot work. So, so in addition to all these hazards, we know that informal workers face many socioeconomic factors that also impact on their health and working life. Next slide, please. Next slide. The one before. Yeah. Also, we have migrant workers who are among informal workers, and both international and internal migrant workers. And we know they are often in what we call the 3D jobs that are dirty, dangerous, and demeaning. Now, this example is here in Australia, where we have seasonal transient workers coming from the Pacific Islands on a formal scheme, but their work arrangements, their living arrangements are quite informal, and there are very several occupational health and safety issues there. Next slide, please. So to understand the health and safety challenges of informal workers, we need to understand the roots of the inequity, and this lies in the global distribution of wealth. And as you can see very clearly from this data, many of those 55% of the population that has to manage with just less over 1% of global wealth consists of the informal workers that we are talking about. And that is one of the great challenges we need to deal with, in addition to looking at improving their workplaces. So when we talk of decent work for informal workers, that also means a fair wage for the work they do. And the several social determinants that impact upon their health as a result of this wealth distribution are quite important. And I know there are several speakers today who will be addressing some of these important social determinants. Next, please. So as professionals in occupational health, I think our focus and a key factor that we must recognize is the access to basic occupational health services, which ICO has highlighted a lot as BOHS. And for informal workers, these services are to improve their working conditions and prevent their risk of unsafe exposures. And when they are affected, they need to have access for early detection, diagnosis, and treatment of occupational illness and diseases, and to have the opportunity to return back to their work, which gives them a living. But this access to these services is one of the major challenges I think we face and need to address. Now, the other important area is legislation. Work health and safety legislation is very crucial because it provides the framework for the enforcement of rules and taking action to improve workplaces. But we are well aware that in many countries with high informal workers, the legislation does not cover the informal sectors. For example, in India, which has almost 90% of the workforce informally, none of these workers are covered by health and safety legislation. So in many countries, the WHS legislation is quite archaic and very prescriptive. So you need some changes also to address better health and safety legislation. Now, in most places, traditionally, health and safety legislation is based on the employer-employee relationship. And with informal workers, this has been a challenge with legislation. But 15 years back in Australia, we dealt with this in our model legislation by changing the concept to employer being replaced by person in control of a business undertaking, and then replacing employee with worker, where now we cover all workers in a workplace, including those who are informal or even volunteers in a workplace. So there are ways to change legislation to get coverage for informal workers. Even if we have good legislation, the other problem is regulators in many of the countries that we talk about with high informal workers. Most WHS regulators are often in these countries are not effective because they are poorly resourced and are often not accountable and with political interference in their work. So this is another area where globally we need to improve the labor inspectorates and make them more effective and better resourced and skilled to deal with informal worker conditions. And the other area I think is very much as occupational hygienists, ergonomists, and other professionals that are present here. For us, I think providing specialist services to informal workers is one of the great challenges. because we know our disciplines have very effective, powerful tools that we have that can prevent work-related illness and disease. But we know, unfortunately, similar to the inequality in global wealth, the access to basic occupational health services is also very unequal. Only about 15% of workers in the world have access to occupational health, these basic services, and many of them are not informal workers. And similarly, when it comes to research, the lack of funding and the attention to informal workers means that there is very limited research done on informal workers, which deny us the data and insights that are required to make policy and develop programs. Next, please. So the ICO Scientific Committee that Akran mentioned, the Scientific Committee on Small-Scale Enterprises and Informal Sector, over the past decade or so, we have taken several initiatives to address these. One of these was, this is our vision is to build better capability among people who provide these services to the informal sector, and also promoting access to these services for those working with informal workers. And part of this work, we have organized and conducted several workshops in different countries, and one of them was in India, looking at improving prevention of silicosis and tuberculosis, both very commonly found among the informal workforce who are exposed to silica dust. And what we did was to provide these skills, these basic skills, to a range of stakeholders, which included some civil society organizations that work closely with informal workers. We also ran a workshop where community medicine students were provided training in work history taking, which will go a long way in helping them recognize occupational illness and disease in informal workers. So through this work with the ICO committee, we have, as you can see here, several colleagues from different countries and different disciplines working together in these workshops. And through these, we have developed several appropriate short modules that are suitable to build some basic skills within the informal sectors and people working with those groups. And as you know, ICO has several MOUs, memorandums of understanding, with professional partners such as the IEA, IOHA, the Occupational Hygiene Association, and also with IALI, the International Association of Labor Inspectorates. So we are looking forward within ICO how we can work together through these memorandums and bring these different disciplines together to in supporting and working together to progress some of these initiatives. So these are something we'll be looking forward. The ICO has a board meeting coming up in October this year, and through webinars like this, the engagements here, we can put forward some proposals to take some actions together. Next slide, please. So we are globally, I think you'll all recognize we are in a very important juncture in the world today. There's the challenges of climate change, but also there's rapid technological changes that are changing the world of work, as we know. And also there's unprecedented social and economic shifts, and of course, the various geopolitical conflicts. So in this kind of global situation, when these changes happen, it is always the most vulnerable and marginalized who are the most affected by these changes. So to address these great challenges of providing decent work and good health for these most vulnerable and marginalized workers, we need to also tackle those inequalities in global wealth that I alluded to before. And I believe to address this as OHS professionals, I think we need to shift the current paradigm in occupational health to make this happen. Because I believe the current occupational health approach we have is largely focused on some of the few larger industries and workers in the higher income sectors. So these informal workers and also workers in the small, medium enterprises who comprise a large sector, large number of working populations in most countries, do not have access to these occupational health skills and expertise that we offer. So we need to make a shift in how we conduct the business model of our disciplines, and also how we deliver our capability building, the training, which should be more appropriate to address these problems in with the informal workers. So just the final slide. Yeah, next one. So in conclusion, as I said before, I want to put forward some pathways for decent work that we can work together in this journey to get better, to improve conditions for informal workers. The first, as I said, is to have regulatory reform, so that changes in legislation and building better labor inspectorates. This is a big challenge for many governments. And through that, to look at better enforcement of health and safety legislation for these large sectors of the workforce who are not covered by it. And secondly, I think this is area where most of us professionals here could take action, is to improve prevention in our practice. There's a lot of work I know being done on raising education and awareness among informal sectors, but we can do a lot more work in bringing better hazard identification and risk control to a lot of the workplaces that these workers are in, because as you know, prevention is the best way to reduce the illness and injuries that we see among these workers. And especially among the medical sectors, to have access to these basic health services, especially health surveillance, monitoring of health, and treatment of informal workers, and access to their communities. So I'm sure we'll hear a lot more, I see in the program, from our next speakers on each of these areas, and some of the excellent work that's been done by some of our colleagues around the world. And finally, I think research is very important. Those who are undertaking research must be well aware of the participative action research. This is the sort of research we require to address issues with informal workers. And lately, I have seen several very good research work coming up for review, where focus groups with informal workers have been conducted in gathering valuable insights in what are the real challenges and needs of the workers. So this is again another area I think we'll look forward to hear some of the new approaches in dealing with it. So just for the last slide, in conclusion, these are some of the references for the data that I have provided. And next slide, please. finally. And I want to thank you for the opportunity to speak in this webinar, and I'm sure we'll have some questions to answer in the discussion later. Thank you.
Well, thank you very much, Dr. Mahinda. Very, very good presentation as usual. So you did excellent time-wise. I'm gonna have a few comments per your presentations, and then we're gonna immediately go to our next speaker. So one of the highlights that you mentioned would be, the importance of informal workers and addressing 60% of the population. Some of the challenges are, heat stress, for example, access to occupational health, and sometimes, the lack of any legislation at all to protect these workers. But not everything is bad news. There are some good initiatives going around the world. For example, and you mentioned just this change of semantics in the legislation from employer to person in control and employee to workers makes a big change and goes a long way to be more inclusive of these workers, which is what we want to portray in this webinar. How can we be reciprocal for all the contribution that they give to society? And you gave some important numbers also. For example, if we know that 60% of the population is informal, then that means that it leaves 40% of formal workers in the world. But only 15% of the workers globally have access to occupational health. So what that means is that only 15% have access to occupational health, regardless if they're formal or informal. So we have a lot of work to do as specialists in occupational health to protect all workers. And finally, you concluded with regulatory, preventive, and participatory action research, which is very, very important. And the word participatory is extremely important in everything we do because the workers need to have a voice, and that is important for it to be inclusive. Well, thank you so much. And then I'm going to segue immediately to our next presenter. We're going to leave the Q&A for the end. So thank you, Mahinda. Okay.
Thanks.
All right. So now we're going to move forward with our next presenter. We have the privilege and honor to have Professor Andrew Thatcher. Dr. Thatcher is a professor in the psychology department at the University of Witwatersrand, South Africa, with a PhD and master's in psychology and organizational psychology, respectively, from the same institution. A certified professional ergonomist with the Ergonomic Society of South Africa, and a registered industrial psychologist with the Health Professional Council of South Africa as well. Andrew is the president of the International Ergonomic and Human Factors Association, a member of the Human Factor Ergonomic Society of the USA, and a member of the Academy of Science in South Africa. Andrew has served as co-auditor and chief of the ergonomics and is a recipient of several awards, including the NSTF South 32 Green Economy Award, the Hall W. Hendrick Distinguished International Colleague Award, and the Wits University Vice Chancellor Award for Teaching Innovation and Social Impact Research. It is a great honor to have you, Andrew. Please, the floor is yours.
Thank you. Thank you, Akran. It's wonderful to be here chatting to Sazom and other colleagues from around the world. I'll just jump straight into my presentation without anything about the International Ergonomics Association. The case study I'm actually going to be talking about today is not my case study. It's actually a case study taken from my colleagues down at Rhodes University. With their permission now, I'm presenting some of the material which they looked at in one of the case studies and looking at applying an ergonomics approach to understanding informal workers. I'll talk about that just a little bit later in the presentation. So I think it's worthwhile just context about the difference, first of all, between the informal economy and informal workers. So up over here, it's worthwhile showing that the informal economy talks about the whole structure which might include economic activities and businesses as well as workers, which is generally not taxed or regulated by the government and therefore lacks formal legal protections and social securities, whereas the informal workers are the people working in the informal economy, but not always. Sometimes there are informal workers who are not in the informal economy. We're seeing a larger number of informal workers working in informal employment positions, but also lack formal protections in those situations. So it's important to point out right at the very beginning when I talk about informal workers that I'm not necessarily only talking about people that are poor or only people who are working in under precarious conditions. But there may be a bunch of others like entrepreneurs and money brokers and people like that who would also fall within the category of being informal workers, but they're not the type of informal workers which I'm going to be talking about later on in this presentation and which we generally refer to when we talk about informal workers. In the South African context, our push towards informal work and informal workers is largely driven by our huge disparity in between those people who have things and those people who don't. It's very often characterized as the Gini index, and if you look, this is the Gini index, and I've tried to put some in this particular slide, try to put some of the more sort of countries which we generally get compared to rather than looking at global north countries. And you'll see that the inequality in South Africa far outstrips even our closest competitors in the inequality index, countries like Costa Rica and Colombia. That South Africa's index sits somewhere closer to 67, and the closest person who has an inequality anywhere near us is Colombia with a inequality index of about 56, so a good 11 points behind us. Where does this inequality come from in the South African situation? Well, it's partly due to the legacy of a sort of a post-apartheid South Africa, where extreme wealth was concentrated in a few number of people, and many people, usually based on racial segregation, were economically excluded from wealth. And even any opportunities to gain wealth. This still exists today. The wealth isn't only racially based, although it's still primarily racially based. In this particular slide, you can see the top 10% of earners in the country capture more than 65% of the national income. And even if you take just the richest 1%, they earn 20% of the income. What this leads to is huge amounts of disparities in wages, for example, between what a CEO earns and what the operational staff earns, which may be several thousand times more what a CEO earns than the operational staff. And that we see not just in the formal sector, but we also see that mirrored in the informal sector, where some people can earn huge amounts of money, but actually the majority of people are earning very little. It's exacerbated by stagnating growth. Over the last 2 decades, growth has been in the low single digits, which means that we're not really able to generate the types of jobs for youth coming, particularly youth coming into that labor market, and creating jobs for existing people who are already in that job market. And this leads to really, really high rates of unemployment, which I'll show you on this particular slide over here. Our rates of unemployment, this is done on a year-by-year basis since 1994, when we had our first democratic elections. And it started off at about 20% unemployment, which is already incredibly high on the world stage, and is now, over the last 5 or 6 years, 7 or 8 years actually, has been sitting well into the 30s. That means 1 in 3 people are unemployed, and that's with a fairly lenient definition of unemployment. So in this definition of unemployment, it says basically anyone who's looking for work but hasn't found work and hasn't been working in the previous 4 weeks. Essentially, this means is that if someone was looking for work 4 weeks ago but has now given up, or 7 or 8 months ago and has now given up, they don't get counted as unemployed. they just get counted as part of the people in the population. They're not actually even included as unemployed people. So with this high rate of unemployment, this high inequality, and people's need to either starve or find some way of gaining some form of income to be able to feed themselves and their families, we see an increasingly large number of people turning to informal work, very often in precarious situations. So those numbers, it says thousands, we have to multiply that by thousands. So currently at the moment, you'll see across this graph from over the last 10 or 12 years, we've seen the number of people in South Africa who are moving into informal employment has steadily been increasing. We're sitting now at roughly 7.8 million people that would be considered to be workers in the informal sector. I said earlier that it's not just people who are in the informal sector who are working in precarious positions or precarious jobs, but there are a group, in fact, a substantial number of that 7.8 million. If we look at this graph over here in 2023, almost 2 million people who work in informal businesses. So these are businesses that actually employ more than one person. They're not formal in the sense that they have formal work contracts or that they have recognition and formal labor protection. They're really small businesses. And what's happened in this particular area is that they're able to employ a number of different people working for them, usually sometimes family-owned businesses, but not only family-owned businesses. And what's quite interesting about this is you'll see over the years, over the last 25 years or so, this was largely an area which was predominated by women. So women were mostly likely to be these small business owners, these informal small businesses. But that's changed over the last 6 or 7 years to be predominantly men, and that's largely because of the change in the demographics of who's been employed. So we've seen a lot more men having to move into this space because they can't find employment in the formal sector. This graph is really interesting because it shows in South Africa in which industries or which areas we find the informal workers. The largest area is very definitely in the trade. So if you, and anyone who lives in South Africa will know this, at just about every single traffic light, you will find people trying to sell you things at a traffic light, cool drinks, everything from small little items all the way through to large electronic goods they might try to sell you at a traffic light. But that's steadily been decreasing over the last 25 years. It's still the most dominant area of which people are working, but it is slowly decreasing. The other interesting thing about this graph is the agricultural sector. Across the rest of Africa, the agricultural sector is where we find the largest amounts of informal workers. In South Africa, that's not the case. In South Africa, our informal workers are not in the agricultural sector. They generally tend to be in the trade sector, but also growing areas in community and social services and in finance. These are areas which largely are growing, and others which are staying relatively stagnant are construction, manufacturing, and transport. So this presentation is about ergonomics and the ergonomics or human factors approach to looking at trying to look at helping informal workers and working with informal workers to improve the informal workers' situation. So it's worthwhile looking at what the definition of ergonomics and human factors is. So first of all, it's a design discipline, and it focuses on looking at things from a systems perspective. It has two elements to it. There's a science element, which is the research, primarily what I'm focused in looking at, trying to understand what these issues actually are, and the practice element, which is actually going out and doing it in the workplace. I do a little bit of both, particularly in the research which I'm doing. And we have two goals which we're trying to do. The one is to optimize system performance, making sure that the system as a whole is working well. In a business, that might mean worker performance, or it might mean things like productivity. In more informal contexts, it might mean making sure that people are well looked after within the system, that they are able to meet their needs. And the second goal is about well-being. And here we talk about both psychological and physical well-being, because we're looking at human beings as an entire system. So this is the diagram I show. It's pretty busy, but what we mean when we're talking about ergonomics and human factors, very often when people think about ergonomics and human factors, they look at that physiology bit at the bottom. In other words, looking at the anatomy and the biomechanics and the physical abilities and what people are able to do. But actually, it's a lot more than that. We look at both the physiology and the psychology of people, the mental workloads, our abilities, mental abilities, etc. That's done when looking at tasks, the things that people perform, the tools with which they perform those, and the environment where it is performed. And that's what we mean when we say we take a systems perspective. So we're looking at what are the tasks they're doing, what are the tools and the equipment that they're using, and what is the environment in which this is taking place. What we call ergonomics is the collection of these things put together to understand human work. So whenever you see these things, this is my new mission. Whenever you see a thing that says an ergonomic mouse or an ergonomic keyboard, an ergonomic chair or an ergonomic hammer design, it's ergonomically designed. This isn't ergonomics. This, to an ergonomist, doesn't actually make any sense at all. These are nonsense. There's no such thing as an ergonomic keyboard because, first of all, it depends what the person is doing. So what tasks are they doing? It depends on what environment they are doing them in, and it depends what other equipments and tools and stuff they may be using. So having a computer like this and an ergonomic keyboard, you would never find this, for example, on the inside of a motor vehicle, okay? Because you're doing all sorts of other things at the same time. So this ergonomic keyboard only makes sense in one context, when you're doing specific type of sedentary office work. So talking about, and anyone ever tries to sell you a bit of equipment that says this is an ergonomic mouse, just tell them that Andrew told you, the president of the International Ergonomics Association told you that they're talking nonsense, that actually you need to look at the work I'm doing and sell me something that's appropriate for the work that I'm doing. Now, straight on to the, I'm trying to make sure I keep up with the time, and I realize I'm already a little bit behind. This is the case study which I've been very kindly allowed to use. It's something which is called Warwick Junction. It's an informal trading market, in fact, more than one market. It's several markets all put together right near a train station in Durban. There's various different types of markets that are here. You'll see on the right-hand side, there's the bovine head market, sheep's heads and cows' heads, etc., being cooked or being butchered and then cooked for people to eat. There's also an early morning market, which is largely fruit and vegetables, but also some meats. There is a herb market, which is a permanent market, which also looks at medicines, herbal medicines. There is also a clothing market, and then there is just a general market for other commodities that people need. So when we talk about Warwick Junction, it's actually made up of a whole bunch of different types of markets that are all closely located with one another. It's located very close to a commuter center, so a lot of the people using the train, but also the minibus taxis. This is it's linked in with these commuter services, so you get a lot of people moving through this area, which might need to collect things on the way to work or away from work. So it's very well located in terms of its commercial possibilities. This is some of the examples of the types of things which the informal work which happens in Warwick Junction. Some of them I'm going to talk about in a little bit more detail. In the top left-hand corner, we have someone who's selling fruit and vegetables. And the bottom left is clothing. These are usually second-hand clothes. The top right-hand, you can't really see, but she's the woman at the back's actually got her head in a drum. Where she's starting up charcoal to cook corn mealies. And the bottom right that's an example of the bovine head worker who's actually carving up over here. I think that's a sheep. And he's going to be cooking that during the course of the day. This research was conducted over a number of months. The ergonomic team, led by the Human Kinetics and Ergonomics Department down at Rhodes University, was asked to come in and look at what was happening in this marketplace in Warwick Junction, to try to see if they could help the different informal workers with the different types of work that they were doing. I'm just going to look at 4 different jobs that are in here. There were many, many more jobs which were included in this research, but there's only really time to look at 4 of them, perhaps not even enough time to look at 4 of them. So this is the bovine head cook, butcher or farmer. And you can see in this particular photograph the type of work which this person is doing during the day. So they've got over here they have a concrete surface and a number of different tools which they're not really formal butcher tools. These are axes, and in the case of what he has there, a panga, which is usually used for other circumstances. He's having to do this work in such a situation where his elbow is lifted well above the shoulder, having to apply enormous amounts of forces to be able to cut through skin, cut through muscle, and cut through bone in order to be able to perform this work. So what we find, and this is just breaking down what we do in an ergonomics assessment, is look at what type of work they're doing and how long they are doing that work for. And actually, when they were doing this work, they extended it to try to say, listen, what's also happening outside of the work? In other words, what type of rest are these people being able to get? And in this particular graph, what we see is that this person's working probably from about 4:30 in the morning until about 6 o'clock at night. So incredibly long periods of time, 7 days a week. And for a large part of that time, they're working in some very awkward working postures, what I described earlier, especially this sort of cleaving and cutting processes which happen early in the morning and late in the afternoon. What you can also notice from this is that the actual amount of time, because there's a commute getting to Warwick Junction and getting away from Warwick Junction, this particular person on average gets roughly about 5 hours, in fact 4.5 hours of sleep a night. So you're working a 12.5 hour day and getting 4.5 hours of sleep every single night. So this is obviously a situation which is going to be pretty dangerous working over a long period of time. It gets even worse when you look at the busy times. So in particular times of the month when it gets really busy, where you'd be working up to 15.5 hours. Usually these happen on a Friday when there's people, when you're working much longer hours and they're getting maybe 4 hours worth of sleep a night in situations like that. That other lady, which she was a millie cooker. So essentially what she's doing is she's spending a large amount of her time starting fires, making sure that the millies are put in there, that they are cooked, usually working in a situation where there's a lot of smoke and heat exposure. Again, working 7 days a week. This person's not working quite as long, mainly because millies are usually eaten later on in the day. So they're not just done as a breakfast, but also they're done more sort of in the evening. But she's still working 12.5 hours. They're getting 5 hours of sleep a night. And during busy times, that may go up to 14.5 hours, with 2.5 hours spent commuting. And then usually what she ends up doing in situations like this is she has to forego the housework. So she would also be doing other work in the house, which is another form of informal work that we need to look at. One of the things which happens in Warwick Junction is that the municipality was very uncomfortable about people being there. They actually wanted to try to stop all these informal traders being there. So what they did is they switched off the water. So what that meant is they couldn't get any water for cleaning or for drinking or anything like that. And instead of that actually closing down the Warwick Junction and the informal trade, what it did is it created a new job. And that was this new job of something which is called a water transporter and seller. And what happens with this water transporter and seller is he travels from much further away, goes and fills up a number of containers, and then brings that to Warwick Junction and sells the water to people. Now, this is a very interesting job. Not only has it created a new job opportunity by trying to stop informal work altogether, but But this is actually, apart from the really heavy workload that's the work rates and heavy load that the person needs to carry, up to 400 kilograms, traveling up to 5 kilometers from where the water source is to where it is they're going. So 10 kilometers, which they'd be traveling in a day, 5 kilometers without the load and 5 kilometers with the load. They actually get quite good sleep and quite a lot of rest, but their work is really, really intensive. And the thing that they're most likely to experience is harassment from the municipality to actually try to stop them, because they've now created this job opportunity, and they don't want people to carry on allowing the informal traders to carry on. During the busy time, this person might be working up to 12 hours. They'll need to take some breaks because of the heavy load during the course of the day, and they'll get away with that by reducing the amount of sleep that they might get down to 7 hours. Now, the interesting thing about the informal work in the South African situation is that because of this high amount of inequality that we have within our country, we actually have these two economies living side by side. So we have these informal trading in Warwick Junction, and 10 kilometers away in Prospecton, we have a car manufacturer that's manufacturing cars using a high amount of robotics. These two things coexist in pretty much the same city at the same time. So we have to try to work out ways in which we can try to integrate these two systems. Okay, these two different types of informal work system and formal work system, high amounts of technology, low amounts of technology, great deal of improvisation or low amounts of improvisation, but workers working together and moving through the same types of spaces. So what does this mean? It means something which we call joint optimization, something which those people who work in the areas of technology and resilience engineering. It is about trying to understand how we might optimize these two systems to work in cooperation with one another. There's a lot of theoretical work which is being done on this. Guy Walker's been writing about this for quite a long time, particularly in urban environments. Nick Pataniti is in Australia has also been thinking about cities as joint complex socio-technical systems. And so we need to be able to understand how we can get these joint complex socio-technical systems to interact with one another and to be able to accept one another so that we can create economies which are both formal and informal and mixed. However, what this means is having a radically different rethink about how we think about workers. It means thinking about, comes from my colleague Gemma Reid in Australia. It means thinking about human beings as assets. We need to think about technologies as being tools to assist humans, not tools that replace humans. We need to look at how we might promote quality of life, so beyond just the work situation. We need to respect these different types of individual differences, and we need to understand where the different stakeholders fit in and come together. Essentially, what we find, particularly in the Warwick Junction case study, is that the informal workers are seen as a nuisance, whereas the informal workers themselves feel that they are providing an invaluable service. They gain a great deal of job satisfaction and life satisfaction from being able to provide a service to the community. So this is really about re-looking at what people are doing and thinking about how it might integrate in a more modern African type city context, make sure that we can try to resolve some of the problems which are happening here on the right-hand side. And with that, I'm actually going to stop at this particular moment and hand over to Dr. Akran. But while he's got some comments, I'll just leave this up over here in case anyone would like to learn a little bit more about International Ergonomics Association and the type of work which we do. Over to you.
Thank you very much, Andrew. That was marvelous. As an ergonomist in heart, a lot of things resonated on me as well. And So some of the highlights, presentation I mentioned, we're going to leave the Q&A for the end. There is one question, we'll leave it for the end as well. So one of the things that I want to highlight are, that sometimes informal workers are not in the informal economy, but at the same time, formal workers lack some social protection. So that's a very important point. So to highlight. When it comes to employed, it's usually a sub-registry. When they are not employed and they're trying to get another employment, they're in that limbo, but they need to eat. They need to bring food to the table, so they go out to the informal economy, which is always a safe haven in a way. And you have also the small businesses that are, you can speak about them, as informal as well, but they're not necessarily precarious. That was very, very important. As an ergonomist, is a design discipline that also focuses on the system. And when we speak about informality, well, informal work, it's a system that that we need to see it as a system. So that's why the Ergonomics Association and the human factors approach is very important in this. And like I've always said when I put my ergonomist hat, when you come in as an ergonomist, they think that the chairologist is coming. I call it the chairologist. This is the guy that's going to come and change my chair. But there's so much more to that, so very well. And I will tell the rest of the world that Andrew Thatcher said that. So we're good at that. I'll take on that approach. All right. So I guess on the presentations that you made, very important aspect on my takeaway on this is that we usually try to adapt workplaces to human and workers. But most of the times in informality is the other way around. The human is adapting to the work needs just, to try to perform the best they can. But at the same time, you ended up with job satisfaction, which is interesting, no? How satisfied they feel in their work, regardless of how precarious or difficult it is. So we can leave the rest for the Q&A. I'm going to thank you, Andrew, and I'm going to immediately go to the next speaker. We're going to close with a bang in this first panel with Mr. Matthew Aloda. Matthew is a chartered occupational hygienist with over 15 years of experience across the oil and gas manufacturing and aviation industries. He specializes in exposure assessment, industrial ventilation, and the control of diverse occupational hazards. Matthew has led occupational health programs involving multidisciplinary teams and is highly skilled in health risk assessments, medical surveillance, and workplace health evaluations. He currently works for Irving Oil Limited in New Brunswick, Canada. Matthew holds certifications on industrial hygienist, certified safety professional, and is chartered member of the British Occupational Hygiene Society. He's also certified member and immediate past president of the Industrial Hygiene Association in Nigeria. Matthew currently serves as the board of the International Hygiene Association and the president-elect for 24-25 term. He holds a bachelor's degree in engineering from the University of Urin and a master's in occupational and environmental health from the University of Portsmouth, UK. Matthew, it's a pleasure to have you here with us, and the floor is yours.
All right, thank you very much. I was struggling to find the mute button. Confirm you can hear me clearly.
Yeah, we hear you great. Thank you.
Excellent. Thank you very much. Like the other speakers, it's a great honor to be here today, and I'm really delighted to share and engage with this team. We've said a lot about informal sector, informal workers. Really, my own presentation will be, yes, we've highlighted a lot of gaps, and some of the initiatives have also been mentioned to close this gap. So I'll be speaking on let's close the gap. What can we do in the occupational health space, poverty and decent work for informal workers? I'm particularly delighted that I'm going to be having this conversation with what I refer to great partners of occupational hygiene, which will be the occupational physicians. So you will see me talk more about how we can work together and how our work overlap. So moving on quickly, what exactly are we talking about? What is the global challenge for occupational health? What exactly is the challenge? I'm going to share some stats now, and I don't know how many people on the call can connect with these numbers and if you've seen it. And every time I see these numbers, I ask myself, are these numbers really real? And this is what happens in a year. The ILO estimates of 2.93 million people die annually from the fact that they go to work, right? So out of this 2.93 million, 2.6 are from occupational diseases. So that speaks to what exactly the focus of today, right? So if really 2.6 million people die as a result of going to work, exposure to hazardous substances, hazardous situations, it means that technically, since I started speaking, maybe we've lost 10 people if this data is real. And this is off the ILO. Just put me in the chat if you can just say yes or no. I'll look at it later and I'll leave this on for you guys to just soak it in for like 30 seconds. Have you seen this data or are you aware of this data? If it's yes, just put yes in the chat or no in the chat. If you can do that for me for the next 30 seconds. It's very sobering for me. And I think the question, now that we're talking about informal sector, what percentage of this number do you think is from the informal sector? That's another question, right? So who exactly is dying? Is it people in the formal sector or the people in the informal sector? What percentage? We don't want anyone to die, but again, I'm trying to raise the conversation about the need to really look at the informal sector and ensure that we do something better for them. Okay, moving on. I'll look at your responses later. I've had this slide for several years, and anytime I look at it, I am happy to share it. And this is what do we do when we talk about health risk management and health risk management program. Really, we try to promote health and safety, like the conversation we're having today, prevent, heal health, death, then of course, mitigate disease. And why I'm bringing up this slide really is because I know we have occupational physicians in the room. Every worker, whether you work in the informal sector or in the formal sector, once you get out of your house to go to a place of work, you are considered as a vulnerable individual because you're going to be exposed to various situations or hazards in the workplace that makes you vulnerable. And that's the very start of this arrow. So we are all vulnerable because we go to work, right? So every workplace has some form of hazards. And that's where occupational hygiene is coming. So the first part of this triangle as it progress, of this arrow as it progresses towards the right, you have occupational hygienists playing a great role trying to ensure that the blue arrows from that you can see pointing upwards, those are the kind of things that occupational hygienists will do. Evaluate exposure, put exposure controls in place, recommend medical surveillance, and the likes. And we have occupational physicians coming in at the tail end, really overlapping a big chunk of the arrow towards the right in detecting disease, early detection, management of diseases, even if it happens, to ensure that we give people a chance of survival. So I really think it's very important for us to understand how this program works and where we both sit, occupational hygienist and occupational health, and let's work more. The handshake of this group of professionals need to be stronger. We need to collaborate more. Occupational physicians, occupational hygienists, ergonomics, and all other people in related occupational safety and health field, we need to work more. Right. So what does this look like for the informal sector? We've talked a lot about informal sector, informal workers not having these services. Who is doing exposure assessment for informal work area? Who is providing medical surveillance? And I think the previous speakers have spoken a lot about the fact that we don't have enough people looking at these situations in informal sector. Okay. This statistics has been put up earlier today. 60% of global workforce in the informal sector. We have about 93% of this informal employment in emerging and developing economy in Africa and some places in South America and some places of Asia. So this just tells us global issue. It's not only about being in the informal sector. They're exposed to real situation, real hazards that could lead to loss of life, low quality of life as well. This is to connect us with, I know we've shown a lot of pictures, but really the folks in the informal sector, they're real people. They are brothers, they are friends, they are colleagues, they are family members. So I've got a cup of coffee I've had this morning. Why this coffee gets to me, the process of it getting to me, I think some people, not I think, I know some people have been exposed in some coffee farms to heat exposure, ergonomic issues, and different things. You look at your furniture, somebody probably welded, made some welding to put the work together. So every time, everything we kind of use, there's some form of informal work that's gone into it. And as we use those things just to raise our awareness, we need to make sure, or we need to think about people in those sectors and what we can do to support them. So these are real people. If you take any produce from the farm to eat, there's probably a guy that sprayed some fumigants on it, and maybe, and in most cases, in a lot of farms, people are exposed to hazardous substances as they do that work. So they're real people and real exposures. A bit about the SDGs, and there's a lot of connections with all the SDGs to decent work. Decent work is SDG number 8. It talks about having safe work, decent work for people. And SDG 1 talks about poverty. And the question I keep asking myself, and I think we've had a lot of people speak about that today, the first two speakers, and I ask myself, is decent work really possible in poverty? It's a big challenge. I give an example. I belong to the Nigerian Industrial Hygiene Association, and we had a conference about 2 years ago, and we're trying to get some incentive, or we visited some welding shops, and we're trying to procure respirators for them. The cost of the respirator then in Naira, the Nigerian currency is Naira, is 13,000 Naira. And just one piece of respirator that probably is disposable after about 1 or 2 weeks is going to be gone. And you look at a guy probably that doesn't end up to 50,000 Naira in a month with everything he does. So how sustainable is that? How is this protection sustainable? And the fact that we give out respirators today, it cannot replace it because of, poverty. Also thinking about poverty, the economy, the buying power of the community in some places around the world make guys really look for the best options, right? So if I don't work in the informal sector, I work in the formal sector. If I want to go get a service or purchase an item in the informal sector, you're probably looking for the best deals. And the best deals really would be the cheap ones that have not been able to factor in the cost of protecting themselves into is the cost of his service. So really, poverty and decent work, poverty is really pulling or preventing decent work, actually. And we need to also try to look for ways to address poverty, economy globally. Some of this has been talked about. What's the occupational hygiene challenge? Lack of regulation enforcement. We've spoken about that earlier today. Then we have limited number of professionals. The numbers of professionals available cannot even serve the formal economy. And you all know that the cost of our profession, the delivery of our services is expensive, and it is not accessible to those in the informal work. Absence of PPE engineering controls, good PPE, NIOS certified PPE that are protective, they are not cheap. And how do we make this accessible to folks in the informal sector? Occupational health services, we also talked about that. Then low awareness of risk in the informal sector. So we need a different approach. A colleague of mine once used the word, recently said, we need to be dramatic in how we approach the situations. We've said a lot, we've done a lot of research, and we need to start taking real concrete action. I looked at this, if we are familiar with these conventions of the ILO, Convention 155 and 187, and it talks about occupational health and safety, and its policy governing countries have to have occupational health and safety programs that focus on protection of the workforce. Those are highlights in the first one, Convention 155. We have only 82 countries ratifying this. So 82 countries of the 187 member nations of ILO ratifying that. And for Convention 187, only 73 countries. Why I decided to bring this here is we need to do something different. We need to leave our silos as, researchers, occupational safety and health professionals. We need to do something. We need to engage with the public. We need to engage with politicians. I have one assignment for you guys after this call. Check your country and see whether you've ratified these conventions. These conventions focus on people's safety, health, and well-being. And each country should actually be proud to be connected with this convention. So for me, these numbers are really low, 187 versus what I'm seeing here. If truly health and safety is paramount or is very important for nations, we should be able to speak to our leaders or hold our leaders accountable that we need to connect with this convention so that we can demonstrate that we're protecting people locally. So some of the things we can do really, training and building capacity. My former colleagues, the colleagues that have spoken earlier, they've talked about that. We need to find creative means of making access to education cheap, right? So in developing economies, people really, they might want to develop themselves, build capacity, but there's no access because there's no funds. So I put OHTA there. OHTA is Occupational Hygiene Training Association. They've come up with some ways of developing occupational hygienists, access to it relatively cheaper than what you get in some other places. So if there are such bodies or training organizations or institutions that can come with cost-effective training opportunities so that we can have more professionals, okay? Creative assessment tools, can we build tools for SMEs, for folks in the informal sector, so that if they have someone in the wake of a safety officer or an industrial hygienist, it doesn't need super tools to be able to function, something that is, easy, quick assessment tools that can be used. Our community awareness program, we've talked a lot about this. We need to do more. And of course, start investing or start encouraging research from our various local universities, low-cost suppression system or low-cost tools, exposure control tools that can be used by welders or folks in the field. COVID brought a lot of innovations. We had cloth masks during COVID. Yes, they were not the very best, but at least there was something for that vulnerable population to use. And I would say it did a bit of work in preventing further spread of disease. Free apps, noise measurement, heat stress are available, and we should promote this so that folks can have access to these tools for use. I wanted to show a bit about the gap in the professions. Talking about my own profession, occupational hygienist. This is data of the Iowa International Occupational Hygiene Association. Currently, we say we have about 20,000 people in the field of occupational hygiene. And what you have on the right side of the slide talks about people that are competent, that have been certified by our accreditation program. And I try to break them into the regions of the world. So if you're going to have, like, for a medical doctor, a doctor, when he becomes a doctor, is he can adequately treat or take care of people. So for industrial hygienists, people in that category are what you have on the right side of the chart. And we say in the world that we're only 2 ppm, meaning there are just 2 certified industrial hygienists, qualified industrial hygienists to a million worker. And this is mapped against worker, not the world population. So taking into consideration about approximately 4 billion workers across the world. So in Africa, it's just half a person looking after 1 million people. And again, if I can bet that the guys that are called occupational agents are actually looking after people in the formal sector. So what does this look like? How do we grow this number? How do we get people into this field? How do you build capacity? And what's the right number? And this kind of slides, this kind of numbers should help engage regulators, engage government and thought leaders, business leaders, so that we can have adequate hands to support both formal and in the informal economy. So policy and partnership, I mean, we need to drive systemic change, and the government, we can't do it without the government. So we need to find a way of ensuring that government is engaged at all levels. Professional associations must come together and work. We had a global effort in Osaka recently. I was there, and we had all this organization come together, talk about the need to elevate this conversation. But again, we must work together to really work with government and make sure we have a voice in government. NGOs as well are also there. How do we work together with NGOs, worker organization, labor unions? I was reading an ILO publication recently, and it talks about how to get informal work to formalize informal work, and unions to have a common collective voice would play a big role in ensuring that the voice of workers are heard. Research institutes also have a role to play. So all this, we need to find a way, and we are in a good situation because we, as health and safety professionals, we're talking about this, but how do we make sure that we connect all other partners to ensure that we have the right policies through partnership? I'm sure we can do something better. For me, this is my main slide. And maybe I'll spend a little more time here. We've done the first 3 or 4 items very well, or we've started doing them, and we need to do more. How do we expand legislation to include informal workers? Most of the legislations we have now doesn't specifically talk about informal workers. We need to find a way to embed informal workers, informal sector in our various country legislations. We should build workforce and professional capacity. I talked about the deficit in capacity in professionals supporting the world in my earlier slides. We need to find ways of increasing or building capacity. Occupational hygiene in national legislation. A lot of national legislations, even for legislations that have them, we don't have occupational hygiene built in, or the strategies to understand hazards in the workplace built into strategies by nations. So we need to work or find ways of building occupational hygiene, safety and health into various national legislations. Partnership as well. We talked about various partners. We need to find those partners, resource sharing, engage people. And for me, the 3 items I think we can do better, or we need to do more, because I don't think we've really started utilizing those items in our favor in protecting workers. We need to partner more. We should find traditional, non-traditional partners, journalists. If you look at the guys on the panel, we have professors, we have doctors, we have researchers, occupational hygienists. I really think a conversation about informal work, we probably should have someone on the panel from the political space or labor union. So for future gatherings like this or conversations like this, we want to hear the perspective of politicians or labor union. One of the things I said when I said we should be dramatic, we should leave our silos. We like to do research. We like to make publications, but are we connecting with the decision makers? Really, decision makers will be the politicians, will be the regulators. How are we connecting with them? And that's, you know, for industrial hygiene, I think we can say the same thing for the medical profession as well. It's both science and the art. The science part of it, I think over the years, we've done excellently well. We do research, we do publications. We know a lot of stuff. But the art of it, which is connecting and getting our science to really make the impact that we desire it to make, it's where there's a lot of work needs to be done. Our negotiation skills, our ability to connect, our ability to influence, we need to put that to bear. And again, we might not be naturally skilled, and that's why we are the journalists. Can we partner with them? We are the media folks. Who wants to be a politician among us? Who can we support? How do we engage politicians, and so that we can have a voice on that table? Labor unions as well. Like I mentioned, it would be good to have somebody from the labor union in this space, joining us with this kind of conversation. So besides that, next will be, can we demonstrate value? I showed a slide earlier that talks about 2.6 million people die annually. Who else other than those in this kind of conversation know about those numbers? Do you know what those numbers look like for your individual countries? How many people do we have data? And really, to really have conversations like this and engage the right people, you need to show numbers, you need to demonstrate that there is a case for action. So what's the why of this conversation? Why are we talking about this? And we need to demonstrate the value that we bring as occupational health and safety professionals. When you improve data collection, you can say, in the last year, we had X number of people with this kind of diseases because we started talking about it, we raised awareness, we did this and that, it has stayed the same or it has improved. So when we're able to demonstrate value, both in the organizations we work for and the countries we serve, meaning the government, and we can show real numbers, then people are connected to do more and understand what we're talking about. Also, we need to invest in research. Invest in research, national data stewardship, and that's where we come in as occupational health and safety professionals. How do we attract funds for research? How do we partner to get funds for research to come up with data that supports at the national level, not at the global level, national level, because a lot of things happen at the global level and people don't bring it home, they can't connect with it. But we should have the goal of making sure that people are able to connect with what happens in our space. And of course, stewardship. I have a favorite saying that it's stewardship that drives ownership. If you steward, then you're able to, people are able to connect and own what you're talking about. Health and dignity for all workers. This is not, it is not a nice to have. It is something that we should promote and aggressively make sure it happens, especially elevate the conversation in the informal sector. A safe workplace is not a privilege, it is a right, and it's for everyone. Thank you very much.
Thank you very much, Matthew. That was a great presentation, as always. Well, we're very good on time, actually. Before commenting on some highlights on Matthew's presentation, I would like to please encourage everybody that if you have a question, to place it on the Q&A, or if you have a comment, you can also put it in the chat. That's fine. We'll address it in a few minutes. So Matthew, your presentation was very on point. Thank you so much for that. I mean, you showed some data. There's people are commenting about it, a little bit controversial, but I guess the thing is maybe a lot of this data, the question that raises is does this data include informal workers or not? So I think that's why are you bringing it up. But I mean, I'll leave it to the audience also. And if it doesn't, well, the numbers look big, but it will be a sub-registry, to be honest. So exposure, you need, in order to be exposed, you have to be at work. And I loved your comment that informal workers are real people, our family, our friends, and they're being exposed to all these occupational hazards. The importance of low-cost interventions to actually bring in preventive measures for workers is very important, and policy partnerships and partnerships around the world are very important for bringing the dignifying workplaces for informal workers. I would add from the list that you mentioned, community-based organizations, which are very important partners, considering that most of informal workers around the world are not able to be part of a formal union or formal organizations for their protection. So with that being said, I thank you again, Matthew, and I thank Andrew and Mahinda for this great first session. And now we are going to turn to the Q&A. We have plenty of time. And if anybody please has a question or comment, please go ahead and place it on the Q&A. I'm going to start with the first question. The first question was placed, I believe, very early when Mahinda was presenting. Major challenges among informal workers is illegal migration. Most illegal migrants that find themselves in the informal sector, how can such workers be covered? I think this is a very, very good and appropriate question. Maybe more so for the second panel, which we're going to talk about informal workers and migration. But here in this panel, I'm sure one of you can tackle this perfectly. So if Mahinda, Andrew, and Matthew, if you can, if you wanna go ahead and comment or something, or the three of you, just unmute your mic and go ahead.
Maybe, Akran, maybe I can have a quick comment.
Sure.
Because migrant workers is even currently a major political issue in Australia. Often the politicians make use of the migrant numbers to blame lack of housing and other things. So with undocumented or migrants who expire their visas, we now have in Melbourne a migrant worker centre that has done a lot of work to take action and to get some changes in Australian legislation with these workers' visas. So there are ways that people can take action to change the laws. I mean, we have done something here in Australia in that extent.
Yeah, I was also going to comment, maybe just to reinforce something that Dr. Mahinda said as well, and that is, it isn't always the case that most informal workers, or that even many informal workers are the result of cross-border migrations. That certainly happens in many global north countries. As Dr. Mahinda said, it's very often used as a political tool, a political whipping tool. I mean, it does happen in the global south, but I'm not sure it's quite as large a problem when it comes to the majority of informal workers are actually, if you want to put it this way, homegrown. They're actually from inside the country, and that is partly because of internal economic situations, political situations, as well as government regulations, which haven't appropriately protected certain groups of workers. So, for example, in many countries in Africa, the largest proportion of informal workers are actually in the agricultural sector, because the agricultural sector hasn't been seen as an area which needs protection. The same situation with domestic work, with work in the domestic sphere, that hasn't been properly thought about as an area of workers that need to be protected. Another sort of comment on illegal, I would actually put that word illegal in inverted commas, because it's usually illegal only because people have made up laws to make it illegal, not because there is anything fundamentally wrong about a human being in one place versus being somewhere else. I mean, if we did that, every 99% of Australians should not be there because they're not from Australia. They're from other places around the world. So this term illegal is really just a made-up term.
Marvelous. Thank you both. Matthew, any comments?
No, for me, whatever we classify them, whether migrants, whether informal workers, I think that is not really that they exist, right? So the key thing is what do we do next? How do we ensure that however people get to work, they are protected, whether they're informal or whether they are migrant workers. And I was reading something this morning. I was preparing for this, and again, I think Andrew talked about it. You can actually move in between both sectors. If you lose your job today, you want to do something else or whatever, you probably move into that space. So wherever people work, I think there should be a mechanism to protect them. And that's what this conversation is about. Thank you.
Thank you very much. Thank you very much. Okay, so to the next question, it's specifically for you, Andrew. The mention Kevin Renton, and I'm sorry, Dr. Mushunhe was the person who asked the question before. Apologize, I didn't mention his name. All right. Kevin Renton says, "Hi, Andrew. Thanks for the enlightenment. You're right. We need to rethink the interaction. What recommendations were suggested to the city about Warwick Junction?"
Yeah, hi, Kevin. So a couple of things here. First one coming from what Dr. Mahinda said about participatory action research. A version of that is participatory design. So a lot of the work which was done in Warwick Junction was done as a participatory design process with the actual workers. So not with the city, but with the actual workers themselves. So to give you an example, that's the bovine head worker. So you've got a fixed concrete base, so it's difficult to move the fixed concrete base, but it's really easy to create a platform. And so it was a simple case of finding the right size crates to work off. And so we put the crates underneath the worker. It lowered down the height at which she was working, and therefore put less strain on the worker. We also looked at creating other jobs. So what he was doing was thinking about his business as ways in which he could bring other people in. So he could take breaks during the day to be able to lessen his burden during the day. So he was still working really long hours, at least away from home, but was shortening the amount of work time. And with the melee worker, once she realized actually the environment that she was working in was actually built a chimney out of materials that could be found around Warwick Junction. The basic answer around that was that once you make a worker aware of the hazards which they face in their workplace, they're very good at finding low-cost solutions to their own problems. We didn't have to come up with the solutions. We just had to point out what the problems were and be, oh, okay, I can solve that problem. We can see where that problem is coming from. It was a more difficult question in terms of dealing with the city of Durban, sorry, and for Warwick Junction. So that was actually done through, and of course that's part of the GCIW is WEGO, actually engaged in discussions with the city of Durban to start talking about how you actually integrate this really fundamental service which the people are offering. Yes, it's unhygienic, but it's unhygienic in the sense that you're not doing anything about it. Not because they're there. They're always going to be there. They're going to find ways of being there. If they're not in cover, they're going to be somewhere else. So rather, how do you work with that community to actually help improve their situation? And in fact, you don't have to pay any money to do that. All you have to do is provide the right types of regulatory environments to allow their entrepreneurial skills to happen. That's what's been happening since then. So they've now they haven't switched all the water, but they switched some of the water back on, because now if they switched the water off, then they switched the water back on, then some of the water suppliers would lose their jobs. So it had to be a carefully negotiated settlement. But yeah, there are ways of dealing with it, but first of all, it involves listening. It's probably the most important skill that a human being has. Yeah.
Marvelous. Thank you, Matthew. Okay, so let me see. Let's see. All right, good. All right, let me see. I'm going through the question. Thank you, Andrew. All right, so let's see. The next question, Kevin Renton as well says, yes, see the data, about the data. And then he asked a question to you, Matthew. Your question about the possibility of 2 million annual deaths being real is, in my view, valid. I would like to see more evidence to support it. When one compares the health risk of work in general, the risk is less than not working at all, vis the health worker effect. Do you have any peer review reference to back up the number affected by their work? Thank you for your lecture. Kevin Renton, Department of Occupational and Environmental Exposure and Health, Wits School of Public Health in Johannesburg. Matthew, over to you.
Yeah, thank you very much, Kevin. So those numbers are of the International Labour Organization, so they are not my research, and I've not researched into how those numbers came up and how they are progressing, or who is taking a look or tracking the trend. I know in the publication of 2018 thereabout, it was a bit less than that. I think it's 2023 shows an increase of about 300,000. So I don't know about the trend. It's something I'm interested in. And again, I think the message for showing that, really, I think we should break this down to local numbers. What does it look like in my home country, Nigeria? What does it look like in South Africa? And so that we can connect with it. And like Akran said, what does it include informal sector? And if it doesn't, I don't know what mechanism we're going to put in place, but it will be a good conversation tool to have that data real, and so that we can use it. Thank you. I don't know if any of my colleagues, Andrew, and if you have any insights, yes.
I heard the same argument made during the COVID lockdowns to say, like, we saved so many lives from having a COVID lockdown, but how many jobs, how many people lost their lives because they weren't able to work and gain a livelihood? I'm not sure it's an equal. These are equal comparisons to make, though. It's a little bit like turning around and saying, no woman die from childbirth if you don't have children. Therefore we shouldn't have any children because then women won't die from childbirth. But the fact that women die in childbirth means that we need to do something about that particular problem about women dying in childbirth. And that we show that if we put action into that, we can help women in childbirth. And it's the same type of issue here. Because people are dying at work, we need to make sure that fewer people die at work, not that no people die at work, or that we stop working and therefore people are going to die from working. These aren't equivalent things to compare to one another. So if people are working, or they're working in the informal sector, how do we find ways to protect them and make sure that they're not placed in harm's way? And at the same time, we should also be finding new ways in which we can get people to work, to be a productive part of society. Yeah.
And again, like one of the slides I showed, everyone that goes to work is vulnerable, but our role as occupational health and safety professional is to find those measures to mitigate the hazards that people come in contact with at work, to make sure that they stay under control.
Karan, if I can make a comment on those numbers that—
Go ahead, Mahinda, go ahead.
Yes, please.
Yeah, numbers that Matthew mentioned. I think the important point he made with those numbers is that people die from diseases and illness related to work many times more than the accidents that are recorded. So this is a problem. I mean, a lot of these are long latency cancers and things where we don't see the relation with work and people don't get compensated. So our data is lacking, but these have been based on quite robust estimates, like the burden of disease study that was done by a large global group. I know Dr. Yuka Takala from ICO and I did some lot of work on these data. So that is, I mean, a lot of countries, as you know, don't have even the accidents recorded, let alone the diseases. So I believe this is an estimate, and even the numbers Matthew gave may be an underestimate rather than unproven. This is again the reason why we need to better diagnose and record illness and disease, especially.
Absolutely, absolutely. Well, I want to ask the audience again if there are any questions or comments, please. This is the time we still have time. We don't mind earlier in the first. We don't mind ending the first panel earlier. That's something actually positive, so we can have more time for a break and for the second panel. So I see nobody else asking questions. Well, I mean, just like a final thought. I mean, I think the important. Well, I think there's one question. One second. This has a little excellent presentation, Frida. Oh, thank you, Frida. I'm so glad you're here. Welcome. I guess on the final, as a final comment for this panel, I think that the important thing about I think the important thing is that we have to understand that workers around the world are workers, and we need to have working workplaces dignified and implement preventive measures for everyone. If you're formal, if you're informal, I mean, there is some incredible data being given. Only 15% of the global working population, formal or informal, have access to occupational health services. So, only 15. And then we're debating here that 60% of the population is informal. So probably that 15% is within the 40% that's formal. So that's a number to think about. And one of the things that I've always tried to make a point and push for policy is a lot of the politicians around the world and policymakers focus their accomplishments on work on creating jobs and job creation, formally or for formal or for informal. But then the question you always ask is what type of jobs are you creating? I mean, my question is, are you creating safe jobs? Are you creating dignifying jobs? Are you creating jobs that people are not going to die? Are you creating jobs that people are not going to, or have minimal risk factors for people to be hurt, to get hurt at work? So I leave you with that thought. I think that having work is something that is implicit in human beings. We've worked since the cave ages, but nowadays people are not going to stop working. So the question is, how can we be inclusive and reciprocal to all the contribution that workers around the world are giving to societies, including informal workers and migrant workers? So with that being said, we're going to close the first session. I think now we have, let me see the program. We have until 16:10 local South African time. That's approximately 20 minutes. So if that's okay with the organizers, we can come back in 20 minutes. And we'll give everybody a break, what we call a comfort break and catch-up time. So I guess catch-up time would be maybe texting each other or chatting with each other. Thank you so much. Great session.
See you, everyone.
Thank you.
Thank you, everyone.
Hi, good afternoon, Dr. Maggie. Hey, good afternoon,
Hello,
Dr. Maggie.
hello, Maggie and
Okay,
Jeff. How are you?
I can hear you now.
Hello, everyone.
Hi, Maggie.
Hi.
Hi, Jeff.
Hi, Claudina. Hello, Jeffrey.
How are you?
All well. How's it been going?
It's been going very well. I think the first half was excellent. Thank you.
Good to hear. Well, not surprising, but still good to hear.
No, it's good to hear always.
Yeah.
Right. Yeah, no, the first half went excellent. Hopefully, we'll cruise through the second half even better.
Let's hope it will be. I'm sure it will. We've got very good speakers.
I just wanted to check with Maggie if I'm pronouncing your name right, is it Graf, or you want the G to come more pronounced?
Graph is fine.
Okay, graph. Okay, I
Graph.
get that.
Yeah.
Graph.
Like the mathematical graph.
Yes, exactly the same. Exactly.
Okay, good.
Thank you.
Thank you.
Hello, Christy. Nice to see you too.
Hi, everyone.
Hi there.
Hello.
Hi.
Good to see you again.
You too.
You all ready?
Pretty much, yeah. I've literally just, I mean, as ready as I can be, I've just run out of a 2-hour workshop. So I'll try my best.
No, I'm also coming and going, and I'm hoping that I don't get interrupted. Yeah. We have Andres with us as well, apparently. Good.
Hello, let me see the camera. Okay, the camera is working well. Thank you very much.
Yes.
Hello, Prof. Andres.
Can you put a little bit more light on your face at all, Andres?
Oh, more light. I don't know if I have enough. Let me see a second, please.
Because you've got a very light background behind you, and it's yeah. Jeffrey, where do you work?
So I'm in Pretoria, University of Pretoria, and Gauteng Health Department on a joint appointment.
No, es fresco, fresco.
My experience of Pretoria
Creo que está
is
abierto el
nothing
micrófono.
more than a couple of hours. Pretty city.
We should invite you to our end of year conference. Then you can spend at least a day in Pretoria. That's for 15th November.
I think
We
that's
will
not going to work with my timetable, but thank you anyway.
we will extend that invite from SASOM. Okay, colleagues, I see it's 10 minutes past 4 on my clock. I don't think we have to wait for Claudia to give us a go ahead. I see there's 50 participants back. We'll allow the rest of our colleagues to rejoin as we proceed. So let me start by a brief introduction of myself, Dr. Jeffrey Tafaune. I am your moderator local for the second session. I'm going to introduce to you our moderator for the second session, external, so that she takes us through the session. Let me welcome everybody to this second session in the afternoon. We've had a blissful first half of the session, and hopefully we'll gain more momentum in this second part. So without further ado, our moderator for the second session will be Dr. Maggie Graf. To take us through the session. So this president of and Secretary General of the International Economics and Human Factors Association, the IEA, and currently serves as the European coordinator of the IEA Technical Committee on Informal Work, TCIW, and a foundational member of the Global Coalition of Informal Workers' Health Safety and Well-being, GCIW. Maggie is an economist by training who worked in industry in Australia, followed by research in Switzerland, before becoming the head of the Swiss State Secretariat for Economic Affairs, Occupational Health, Scientific Division. A collaboration with the European Agency for Safety and Health at Work, the EU, OSHA, and the Swiss labor inspectors awakened the interest in the large number of working people who fall outside of the formal safety nets. So our webinar session for today, the session 2, is titled Occupational Health of Informal and Migrant Workers. Of note is that the informal and migrant workers constitute a vital yet often overlooked workforce worldwide. And the webinar brought together international and South African experts to examine the occupational health challenges, explore pathways to decent work, and to highlight strategies for community engagement and collective action, shining a light also on the migrant workers. So over to you, Dr. Maggie. The floor is yours.
Thank you very much, Dr. Tafone, Jeffrey. It's a great pleasure to be with you here today, this afternoon. We have a wonderful group a further group of wonderful speakers. And we're going to start off with Dr. Christy Adiola Braham. Now, I have been aware of Christy's work for WeGo, but she is in fact a public health specialist and doctoral fellow at the School of Health and Related Research of the University of Sheffield in the United Kingdom. And she holds a PhD from the University of Sheffield and a Master of Public Health from the Imperial College London. She had her Bachelor of Science in Biomedical Sciences from King's College London. And as I said, she's the current Workers' Health Coordinator at Women in Informal Employment, Globalizing and Organizing, otherwise known as WeGo, where she leads health research and advocacy to strengthen grassroots workers' organizations and advance occupational health safety and the right to health for all in the informal economy. She's also a Senior Atlantic Fellow for Health Equity at the Milken Institute of Public Health at the George Washington University. She has coordinated regional health and migration platforms, represented WeGo at the International Labour Organization Conference, and where there were negotiations for global standards on biological hazards in the working environment were held. She's contributed to the Wellcome Collection exhibition, Hard Graft, Work, Health and Rights, if I've pronounced it properly, held last year in London, and she has co-authored the Global Health Watch #7. Her work's been recognised by several awards, notably for the next generation of public health leadership. She's affiliated with the People's Health Movement and the World Health Organization Health in the World of Work Network, and she probably has lots of other things that we don't know about. But we're very honoured to have her with us, and she'll be talking to us about the political economy of occupational health and safety and informality. That is, the struggle for health justice for workers in the informal economy. Welcome, Christy, Dr. Christy Braham.
Thank you so much, Dr. Graf and everybody. And it's a real pleasure to be here. And it's actually my first time interacting with SASOM at one of these webinars, even though I know well of your work. So it's really great to be in such wonderful company. So let me just expand my screen. Firstly, I hope everyone can see that okay. And yes, so as was introduced, so my name is Christy Adiola Ibrahim, and I manage our health work at WeGo. I will talk a little bit about what WeGo is. I'm sure some of you might have heard of WeGo before, but maybe we're new to some of you. But first, I'm sure that in the context of this panel, we've spoken a lot about what informality is and what the picture of informality looks like. But I did want to just include this slide, which is made up of data from my colleagues at WeGo, who are statisticians who have been instrumental in supporting the ILO in really trying to understand the magnitude of informality in the worlds that we live in. And so as you can see, that the majority of what we tend to call the global south is where informality tends to dominate the workforce. That's not to say that in places like Europe or in North America that informality doesn't exist. It most certainly does. But it is to say that, as I said, the majority of employment is actually within the informal economy. It's the norm. It's not the exception. And it's growing. The world is becoming increasingly more informalized. Obviously, we're talking to esteemed colleagues based in South Africa today, and as I'm sure some of you are aware, within South Africa, around about a quarter of all jobs are within the informal economy, which compared to the majority of countries on the African continent is actually relatively low. Because, for example, in the other country where I have citizenship, Sierra Leone, informality is over 90%. But nevertheless, informality still makes up a substantial part of the South African economy and South African jobs. And so, of course, it remains a extremely pertinent issue for South Africa, as with many other countries. So coming back to what WeGo is. So WeGo stands for Women in Informal Employment, Globalizing and Organizing. So we are both a organization in and of itself. We support the global movement for workers in informal employment with technical support, supporting them, their mobilizations and their organizing within their worker organizations. But we're also a network. And we're a network made up not just of workers in the informal economy and their organizations, but researchers and development practitioners. And so we're very, very diverse. We are a global network. We're present in over 40 countries, mostly in Asia, in Africa, and Latin America. And we work with 4 key occupations within the informal economy. That is waste pickers, or what you would call reclaimers, particularly in the South African context. We also work with street vendors, domestic workers, and home-based workers. And just to say, the reason for that selection of only 4 principal categories of work is because these 4 categories make up a large part of the most vulnerable forms of work. It's where incomes tend to be the lowest. It's where risks tend to be the highest. And crucially, in relation to WeGo's name, it's also where women often are concentrated within. So now on topic, talking about informality and occupational health. And of course, I don't want to really repeat anything that's been said already and take anything away from speakers, esteemed speakers who are to follow me. But I did want to make a few points about how occupational health relates in a very specific way to all of these workers who work within the informal economy. So we know quite well that workers within the informal economy regardless of sector, do face a lot of risks, and they are exposed to these health risks. And it's not, well, it's risks to their health, but also risks to their livelihoods. And a lot of the reason why they are disproportionately exposed to these risks is because they are not protected from them. They lack many of the fundamental protections that other workers who, for example, work in the formal economy and perhaps work in workplaces that are deemed as being workplaces, they don't tend to get the same protections that would be afforded to those workers there. Many workers in the informal economy are unprotected because they're uncovered by occupational health and safety laws and frameworks where they exist. We know that in some places this is a huge gap where perhaps there are not necessarily specific frameworks in place, but in many countries there are. But there are huge gaps, there are huge constraints, limitations to those various frameworks, in that the majority of workers who may be in the formal economy end up not being covered. So we know, for example, that informal employment is outside of the formal employment relationship. Many workers in the informal economy don't have employers. For example, in Africa, the majority of workers in the informal economy are self-employed. It's about 70-75%. If you think of domestic workers, for example, domestic workers are actually one of the categories of workers in the informal employment who tend to have employers. However, the ways in which that employment relationship works is not seen as being standard. So therefore, they evade that category of formal employment. Another reason why many workers in informal employment are not covered by these frameworks and these laws and these policies is also because many workers in informal employment operate in public space. So when we think about the definition of a workplace, in the minds of many, people kind of revert to the ideas of working in an office, working in a factory, working in a shop. But the reality is that many workers do not work in an office or a factory or a shop. Many workers work on landfills or on street corners, in marketplaces. These are public spaces that are not fully regulated. They are not seen as being legitimate work places by many, including within the occupational health field. And if you think about, for example, domestic workers and home-based workers being, if you think about artisans who produce materials, but within their own homes, and then those materials get passed on further along a supply chain, where they will eventually end up in factories and shops, etc. These workers work within private homes, and private homes also, for many, are not seen as legitimate workplaces. Therefore, there is a lack of regulation, and therefore it's hard to enforce anything within these specific locations. And of course, where your workplace is can very much determine your level of access to provision. So, for example, if you think of a landfill where many reclaimers and waste pickers will go to sort through waste, or what we perceive as being waste, and to collect things that they can later on sell. Many landfills are not necessarily in the center of a city or a town. They are sort of on the periphery, on the outskirts, far away from, for example, not just healthcare clinics and other provisions, but also lacking things like access to clean water and sanitation points and toilets and so many other things that would have otherwise health protective effects. And the reality is that because this is the status quo, many workers in the informal economy are just forced to become self-reliant, to manage their own health and safety needs. Many workers will often pay for access to PPE or access to use a toilet that could be that's not too far away from where they work and sometimes where they live. And so, you know, if you think about it, they're having to manage the situation while they also manage income insecurity, because we know that the incomes of workers in informal employment can often be extremely low, and many face serious poverty for themselves and their families. I'm just including this this graph here, which is it's a part of the sort of theory that emerged through some of my colleagues at WeGo, where we sort of we try to understand the different ways that the informal economy is constructed according to gender and sex, according to earnings, and according to risk. And all of this is to say that the pattern tends to be that at the very bottom of this structure, especially for workers who are working within their own homes, or are sort of doing care-based work, they tend to be women, and it's at that particular part of the structure where both the earnings are the lowest and the risk to livelihoods is the highest. And it's absolutely not an accident, but this is the reality of the world that we live in. Now, work is a social determinant of health, regardless of the form of job that you do, but it's even more so for those engaged in informal work. We know that there are sort of broader macroeconomic and political and social forces which shape the world of work. The simple fact that the informal economy has continued to exist, and to exist in the way that it currently exists, and the fact that it's continually growing because the world is becoming more and more informalized. These are realities that are shaped by legacies of capitalism and colonialism and also patriarchy. And that is the reality also that we have to contend with. This inevitably leads to inequitable distribution of risk to health, and risk to livelihoods, and risk to dignity, of course, because it is, as I mentioned, it is those workers who are at the base of that structure that I showed you, who are accumulating the highest number of risks because they are the most exposed and they are unprotected. So it's no surprise, really, that the people most impacted by exposure to risks to your health and to your livelihoods tend to be women, gender minorities, and racial and ethnic and caste minority groups, depending on the geographic location. So why is fighting for improved occupational health for workers in the informal economy so difficult? Because it really is difficult. I mean, we have worker leaders within our network who have been engaged in this struggle for many, many, many decades, and these are the people that I continue to learn from and be inspired by. But their legacy shows how difficult this struggle is, and there are reasons for that. For example, we know that the informal economy is poorly regulated. As I mentioned, many workers are excluded from policies and laws on occupational health where they do exist. We also know that, particularly for workers who work within public space like markets, street corners, etc., there is very little consideration for health and safety within urban development plans. It's a question of how infrastructure within a city or a town or other urbanized area, how that is constructed and who is it constructed for. There's also an issue here about how well occupational health and safety is understood, and also how well informality is understood. We know, unfortunately, only too well that employers, policymakers, healthcare professionals, corporations, and the general public have a very poor understanding of these concepts. We also know that all of us here know very well that, even beyond just the informal economy, that occupational illnesses and accidents for workers in multiple sort of domains, in multiple country contexts, are very underreported. And that's a reality that we have to contend with. And lastly, workers simply don't know their rights. We see this, of course, within the formal economy as well, but even more so within the informal economy. It's a struggle for workers to even begin to stand up for their own rights if they're not aware of them in the first place. And these challenges fundamentally are political. We know that in many countries, there tends to be very sort of poor collaboration between ministries of labor and ministries of health. They often operate in silos at the expense of workers, particularly workers in the informal economy. And often this is also a reflection of institutional constraints around funding and other resources. We also know that workers in the informal economy have poor access to healthcare. So that sort of element of prevention for eventual ill health and eventual disability, etc., is only made worse when you don't have access to really critical infrastructure and provisions around health and safety that can really protect a worker from either developing a new illness or injury, or from worsening an existing illness or injury. And fundamentally, there is just a systematic lack of care and value given to various marginalized groups of workers in general, but especially for workers in the informal economy. This is also a question of power, and particularly corporate power. That is a huge question here that we have to contend with. And this is the reality of it. But this is not to say that workers don't have a right to occupational health and safety. They most certainly do. All workers, including workers in the informal economy. And there are actually in existence various international legal frameworks that really spell out the right to health and safety for all workers, including those in the informal economy. And I'm just listing here some of them. For example, the Universal Declaration on Human Rights, the International Convention on Economic, Social and Cultural Rights, and of course, there are various conventions and recommendations laid out by the International Labour Organization. And I've just mentioned here at the bottom that the newest occupational health and safety framework that exists at international level is, of course, the new ILO Convention 192 and Recommendation 209 on prevention and protection against biological hazards, which we had the great honor of, as a network, of contributing to within the negotiations, which only finalized in June this year. So let's talk about some of the good practices. I know I'm running short on time, so I'll try and go a little bit quicker. These are some examples that have emerged out of WeGo's network. So Pertimig, for example, is an association of migrant domestic workers in Malaysia. They are Indonesian migrants who live in Malaysia, live and work in Malaysia. They recounted to me at length all of their experiences with facing harassment and violence during the COVID-19 pandemic, partly on account of them, not being native to the country, so being migrants. And this was exemplified by how their employers engaged with them around the topic of COVID-19 vaccination. So Pertimig did a lot of sensitization work with their own members to educate them on how to negotiate with employers, because the reality was that unfortunately, the power dynamic is such that they needed permission from employers to get vaccinated. So they taught these skills on how to handle that situation. They were successful in doing that. They sensitized their members also on how to register for vaccinations, because there was a lot of difficulty doing that among their members. So, this is an example of sort of grassroots action to meet occupational health and safety needs that otherwise have not been met. Another organization in our network, HomeNet Thailand, I've worked with them quite a lot. They are an association of home-based workers, so artisans, also sort of nail artists and beauticians and hairdressers, and also some domestic workers and some taxi drivers. So they're quite diverse in their membership. They also were very active in sensitizing their members on addressing gender-based violence. And they did a very successful project in collaboration with the ILO, which involved developing a mobile application. But I do want to say that it's one thing to work on workers' awareness and to increase that, and that's very important. But nothing will change unless we try to get at the institutions and the structures, and try to address those major drivers. So, for example, I know that we're talking to South African colleagues here, but I wanted to share this example that I'm sure some of you would be well acquainted with. So we have the Satsawu and Udwasa, who are the domestic worker unions in South Africa, who have been challenging the South African government on the COIDA legal framework, so that domestic workers can be included as recipients of who could get compensation for suffering work-related injuries or diseases, or even passing away due to that, and to do this retrospectively. So it's backdated to 1994. As I understand it, this has been a huge struggle, and I believe that some elements of the struggle are ongoing. When I last heard from the Domestic Worker Union, but I thought it was a very interesting example, challenging the legal system, which previously excluded them from something that they should have a right to receive. And coming back to HomeNet Thailand, who I mentioned previously, HomeNet Thailand also worked very closely with the health system to integrate occupational health and safety and occupational health services through primary care into their universal health coverage scheme. So they did lots of really good work on pushing the health system to to offer services to those workers who were not being well covered. So, for example, to do health checkups, and crucially to bring services to workplaces. So, they also ran mobile vans, which were driving around and going to meeting workers where they were. But also an enhanced system of keeping track of occupational accidents and illnesses. And there was lots of health educational interventions as well, and enhanced treatments, workplace assessment, training of volunteers, also who could serve as inspectors. So there was I wasn't at WeGo to witness this intervention myself, but our current international coordinator, who incidentally is South African, Dr. Laura Alphas, was there, and she took this picture of one of the mobile vans. And we know that this intervention and this hard work from HomeNet Thailand really did serve them very well, and it's still something that HomeNet Thailand and also other colleagues within the Southeast Asia region have been trying to scale up and expand upon. So we look forward to seeing that in action. And I just want to finish off just by saying that workers' health, what shapes workers' health, including the health of workers who are in the informal economy, it's structural and political forces. And without acknowledging that, it's impossible for us to not acknowledge those things if we want to see change. So the solutions must all address the underlying structural and political forces which shape workers' health. And I also wanted to share my email address in case you would like to be in contact. And please do look at the WeGo website and look through our workers' health materials on there. Thank you all very much.
And thank you, Christy. There was many points in that I found fascinating and look forward to opportunities to discuss with you in the future. We won't be having any discussion time right now. We'll wait till the end of the session, but we've all got time to think about some of the issues that you've raised and the wonderful points you made for solutions. Thank you. And so the next person on the list, which we should move to very punctually, is Dr. Akran Salmon Navarro. Dr. Salmon Navarro is a physician trained in occupational medicine with a graduate degree in ergonomics and biomechanics and a postdoctoral fellowship in population health and healthcare delivery science from the from New York University. He is primarily affiliated with New York University Grossman School of Medicine, but he is tied to several other academic institutions globally. Akran's focus is on promoting occupational health to vulnerable working populations via multiple global interventions, and more recently in New York City's Health and Hospital, which is the largest public health system in the United States. He has been appointed a member for the CDC NIOSH National Occupational Research Agenda on musculoskeletal health. Internationally, he's a member of the IEA, International Ergonomics Association Technical Committee for Musculoskeletal Disorders, and also the Technical Committee for Informal Work, where I first came across him. Within the International Commission on Occupational Health, ICO, Akran is the current chair of the Scientific Committee on Occupational Health for Health Workers and leads the topic of occupational health for migrant workers. I hope that I've said that all right. And the working group on the future of decent work. More recently, he's one of the leaders spearheading the establishment of the Global Coalition for Informal Workers' Health, Safety and Well-being, which unites the activities of the ergonomists, occupational physicians, and occupational hygienists. And I'm very pleased to say he was elected its very first president several days ago. Congratulations, Akram. He'll be talking to us about occupational health for vulnerable workers, particularly the cross-section between migration and informal work. Welcome, Akram.
Thank you, Maggie. Thank you, everybody. I have to say that the first session was very, very good. So we'll try to keep the same quality of deliverable of the information. I'm going to share my slide right here. Okay, let's see. Okay, here we go. Okay, so can you all see the slides? Yes. Okay. All right. So thank you very much. I'm pleased to present this very important topic, and I thank SASM again for the invitation. I'm going to speak a little bit about the interaction or the cross-section between migrant workers and informal workers. We've been doing a lot of work at ICO on migrant work for many, many years. And although I'm a little skeptical in saying that I'm leading it, because I mean, we have people here at this same webinar, like Mahinda and others, who we lead together as the same way as with the informal projects in other. We're all leading and spearheading in groups synergistically, but we have done a lot of work on migrant workers and within ICO, and then informal works also in other organizations and global interventions. And then we find a very important point, which is, this cross-section between both. I mean, where does migrant workers meet informality and vice versa? And for that, we prepared this presentation for this webinar. Declare no conflict of interest. I always, every time I start these type of interventions, I like to speak about social determinants, but social determinants specifically as work as a social determinant of health. If we read the literature and we see, how social determinants are implied, are published around different organizations around the world, and most of the literature, they always give us, 5 main domains, education, access to quality education, healthcare quality, neighborhood, built environment, social community context, economic stability. But all of us here and everybody around the discipline that we are experts on know that work is implicit in all of them. But unfortunately, they're not even mentioned as one determinant per se. And that's what brings us here today. So if we think about economic stability, it obviously includes work. Built environment, it obviously includes work. Social and community context, it includes work, of course. Now, education, access, and quality healthcare, it includes work as well. We can say directly. I mean, it's significantly related and determined where you live, the quality of the education, the access of healthcare, are all linked to your job, or at least in many countries. Influence goes beyond the working condition. It circumscribes life itself. I mean, you have the physical aspect of it, you have the emotional, the social aspect of it. Also, work as a social determinant influences other social determinants per se, and can affect family and community health and lower levels of unemployment. I always like to mention that, usually politicians and policymakers champion that lower levels of unemployment and unemployment creation are a success or an indicator of a healthy society. But honestly, it doesn't really translate into a healthy society. I mean, the question that I placed earlier in the first session is, when you create more jobs and you, quote unquote, decrease unemployment, what type of jobs are you creating? Are you creating jobs that people get sick, people die? So, are these really worth dignifying jobs? And we're not even talking about informality. We're talking about formality here in this slide. And, and social determinants, we can use work even as a tool. We can use work as a fundamental cause of the social determinant, or we can use work as an intervention as well. We can modify the way people work, dignify their work, and so forth. So the work is an intervention. When it can be a conceptual bridge amongst both. And there's a whole topic that I'm not going to stop on it, that about post-work and retirement. People, quote unquote, say that when they retire, don't work, but a lot of people work a lot more, but more sharing their wisdom and their expertise for the new generations and others. So work as a social determinant of health, we're going to focus on migrant workers and informal workers. I'm not going to go into informal workers as a social determinant because our next presenter, Professor Fandino, is going to explain that more in depth, but I am going to go a little bit more into the migration part. So which migration are we talking about? When we talk about migration, you have different types of migration. You have regular migration, it can be labor, education, family reunion. And then you have irregular migration, quote unquote, it's involuntary or undocumented migration. There's different types of migration. But the fact of the matter is that when we have the phases, when we study in depth the phases of migration, IOM has laid it out very, 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 very nicely, which is, we have pre-migration phases, moving phases, arrival and integration phases, and there is a phase of return. People return voluntarily because they go somewhere else, and when they accomplish what they went for, they come back, or people are forced to come back. So that return phase is also a something that we study in depth, and and there are cross-cutting issues that influence all these phases, such as gender, age, genetic factors, socioeconomic. But the bottom line of this slide is that although these are very well determined, we focus on migrant well-being, and in fact we focus on occupational migrants or work-driven migrants' well-being. And we can hypothesize that all of these phases are directly or indirectly to work. And there's many reasons why people migrate, and the vast majority of people, their main drive when they're on the pre-migration phase is to find work. We see some data here from the migration into the United States. Well, I mean, this might have changed in the past few years, but this is a few years ago. But but it's still very relevant that work is it's the main drive. Schooling is also the main drive. It's also a drive, but also family, safety, diversity, and so forth. But you can also argue that this same data you can see in Europe, and you can see in high income countries. But people who migrate for schooling, for example, some of them work as well. People who migrate for family, people also work. Although they're not their main drive for the pre-migration phase. People need to work to bring food to the table. So work is implicit in all of this. This is just a slide just to understand that most of the migration for labor migration come from low-income countries to high-income countries, and you can see in this graph that, for example, how if you see the x-axis, the higher the income of the country, translates to a higher health expectancy. So normally, when we study occupational work-related migration, it's usually from the bottom left-hand corner to the upper right-hand corner. Now, migration as a social determinant of health. I mean, when we have migrant workers moving, they have the necessity to move. If it's voluntary, if it's involuntary, if it's forced, if it's trafficked, whatever reason, people go to their host country to work, and they try to find work to not only to sustain themselves, but many times to sustain the family back home and friends. So there's individual factors, lifestyle factors, living conditions, working conditions, social community factors governance and social economics. Not going to go in detail on this, but it's a little bit more of the first slide that, we have a migrant worker that goes into different situations that need to be addressed and looked for, and we work on this for many years. When you have the international labor migration, it can begin even from your original country. There's predatory recruitment sometimes. So you bring somebody from their home country, and you bring them to another country, and then they usually come into an employment where there's violence, sexual harassment, inequality. I'm not going to read all this, but we get the picture that although they come to their host country, forced, traffic, or voluntary, the vast majority of them go into precarious jobs that affect their livelihoods, even though they contribute so much to the society they're going to and society back home. Now, there's a cross section between migration and informal work. These are estimate numbers. I can share all the references and resources, but on an umbrella view, there's around 2 billion informal workers around the world, right? And around 150 million migrant workers, approximately, work in the informal sector. In other words, 6% of the total informal work population are migrant workers. But at the same time, if you flip it around, 65% of migrants usually are prone to go into the informal sector. So, and this, we can digest this data a little bit more, which is, a lot of the, and I think Andrew mentioned it earlier in the first session, a lot of the informal workers are not necessarily migrants. But the reason is because informality comes from a cultural aspect of the human necessity, of the human need to work. So I don't need to, a lot of cultures around the world, countries up to 90% of the population are migrants. Are not necessarily knocking on doors to ask for a job within a HR system or looking for an employer or something that's not even feasible, or it doesn't even cross their mind, and to actually look for a quote unquote formal job. So people are culturally and through generationally implicit into formality, and in fact they take pride on this, and a lot of the informality is actually part of embedded in society. Now, with that being said, and we're going to talk about it later on, is how can we dignify their workplaces, improve their workplaces, have them have access to basic healthcare, basic occupational health services, and all of that, Social Security, which is what the whole reason why we spearheaded the Global Coalition, to bring together all the good practices and not so good practices that are going around the world in silos into one place so we can study and understand this phenomenon that englobes 60% of the population. On the other side, we have approximately 65% of migrants that go into informality, because people, usually migrate to another country and they find themselves immediately the necessity to work to bring food to the table tonight, tomorrow morning. So if I cross the border and then I need work, usually the first opportunity is to do something quote unquote informal. Now, this is not a problem. This is a reality we need to manage. We're trying to stay away and shift away from being this problematic, but more, how do we manage this reality, which is most likely not going to stop, and in fact, is probably going to get more profound in the future. Now, clinical scenario, you have migrant informal workers. For clinicians, put my occupational doctor hat, and then when I have a patient that comes into my consultation, there are a lot of scenarios that we need to encounter. There's nutrition aspects, it's accommodation, sanitation access to healthcare. In our health system, in our clinic, for example, we sometimes have workers that work around New York City and they come into our for an occupational issue, work-related issue, and they're in their 50s, and they migrated to locally maybe 10, 15 years ago, and sometimes it's the first time they see a doctor in their entire life. And they don't even know if they're diabetic, they have any chronic disease, nothing. So they come into our health system because they broke an arm, or they have pulmonary issues. So these are things that that are very, very relevant, and they are part of a society. They're part of the workforce, and and we need to take into account, and we do so. A lot of these workers, informal or not formal, we have coining the topic about the 4D jobs. 4D jobs comes from the 3D theory that it was an American neologism that comes from an Asian concept, Japanese, which is kitanai, kikei, and kitsui, respectively, dirty, dangerous, and demanding. And we've been publishing a lot to add the 4D with regards to the discriminatory aspect of how migrant workers and vulnerable workers are performing involuntarily all these jobs that nobody wants to do, but then we do, or they do, as migrants, and so we've been publishing about the 4D job nowadays to acknowledge these social determinants per se and try to push for policy and awareness. So this is a little bit more of what I expect. And one of the main, I really don't like talking about this, but we need to talk about this. One of the main examples is the thousands and thousands of workers that unfortunately passed away during the Qatar World Cup, where we're building the infrastructure, and tens of thousands that are now back home with chronic disease due to heat stress, renal failure, and dialysis, and all of this. So we've learned about this. There's many good things now that have been in place, including in countries like Qatar and other countries that are very prone to migrant workers and informal workers. And we applaud that, and we published through ICO a document that actually brought this along with other publications of the importance that was happening, and things have been moving forward, but we need a lot more work to do. And unfortunately, we always want to acknowledge what happened, so they're never forgotten. Now, let's shift back to the good part, to one more positive aspect of this. So how much do informal workers within and migrant workers within informality contribute? So this is data we want to, the data is out there. It is very good data, but there a lot of them it's in silos in different parts of the world, and then we want to bring it together as how much impact there is. For example, this is a slide where despite the lower median earnings in foreign-born New Yorkers, nevertheless they contribute significantly to the city's economy, health, and vitality. Migrants own 52% of New York City, around 50% businesses, and in 2017, it contributed to approximately 22% of the city GDP. Although this is a very old data, this is data that renews constantly, but the numbers are very similar. Another way that we can see on the contribution are remittances. I mean, our workers not only contributing locally to local communities, but they're also contributing back home. So we see here that almost $800 billion in 2022 from citizens working abroad were transferred back home to India, Pakistan, Vietnam, Egypt, and so forth. So these are numbers that we need to highlight when we want to push for policy, when we want to push for laws that protect informal and migrant workers. There is very little reciprocity compared to what these workers contribute, because as we've been speaking before throughout the day, we're usually not part of the data. So they're quote unquote not part of the workforce. So quote unquote, you're not contributing. But honestly, in a sense, we can see that it definitely is. In fact, we saw a spike on contributions during COVID for multiple reasons, because people were they were locked down, they couldn't move, people needed more money back home. You were working on a high income country, you were sending more money. So we've been seeing these trends over and over. And when we talk about it, this was more speaking about migrant workers. But then when we talk about the larger informality per se, this is, one of the big questions that we want to continue answering. There's a lot of data out there. There's a lot of valuable data and valuable work that's being done by many organizations through the years. And WIGO is one of them. We just heard Christy speak about it. But we want to, not only publish data, but use the data to dignify these workplaces and to bring access to workers who contribute so much to society. There are some numbers that I've been reading. I didn't publish them because we need to bring them together on a more succinct way. But it's projected that 40% of the global GDP it's actually included, or it's contributed by the informal work in different industries. So it's a big number. It's a big number, and that's something that we need to look at, and use it to bring the best for all these workers that are around the world. And now informality, it was also spoken earlier this morning. Not all informal work. It's precarious and 4D. There's with the new forms of work and new generations. My kids, for example, in Gen Alpha, one of my kids is 8, 9, and the other kid is 4. I am sure that they don't want to. And I'm sure that they're going to be more entrepreneurial. They might work a 9-to-5 job, but they might not. So they're looking more into what types of work am I going to do? Am I going to create an app and make more money on my home office, and then just having a regular job? So we've seen this shift, and this is not utopic, and it's not the future. It's now. It's happening right now. So this is something to think about, and they're part of quote unquote the informal work. How are we going to prevent them from getting sick? For how are we going to provide occupational health? How are we going to provide industrial hygiene services? How are we going to provide ergonomic services when they're informally working? How are we going to include them in social security systems? So no, these are things that, although the vast majority are doing more manual handling, biomechanical, and precarious 4D jobs, this is happening right now, and it's going to grow more and more. Shifting more into good news, there's a lot of good practices done around the world, and that's what we want to highlight in the Global Coalition and in other arenas like this one. We work at the largest health system in the United States, around 1.4 million patients. We're a small clinic, the Bellevue NYU Occupational Environmental Clinic at Bellevue Hospital, which is the oldest hospital in the United States. And we have a program that's been running for almost 40 years. I've been there for approximately 10, and we lead a few projects that have what we call a community university collaboration approach. We say university because we're part of a school of medicine, and what we do is we partner with our hospital system, which is kind of like a safe haven hospital. One of the things that you see first when you come in the hospital is seek care without fear, and there's a public letter from the health and hospital system president and all of that, to encourage people to come and actually use the health system, regardless of your ability to pay, regardless of your status or whatever. We welcome everybody, and that's something that it's something that I always like to highlight as a good practice, and something that we should encourage in other areas around the world. It doesn't have to be the largest health system in the world. It can be, the small ambulatory spot on a small town in Southeast Asia or South America or Africa, but it's just the idea of being inclusive is what we try to portray. And I'm going to read the back of my business cards. Our mission is to provide the highest quality clinical and preventive occupational and environmental medicine service to those workers in New York City who are at high risk for work-related disease and most in need of these services, regardless of the ability to pay. So these are ideas that are well cemented, well implemented, and we've been helping many workers throughout the years. So what we do is that we partner with different community-based organizations, with unions, and also proactive employers. Believe it or not, there are some responsible, proactive employers, which we always work with, and we try to work with, and we must encourage working with around the world. But there are different organizations that we partner with to outreach to all these workers, informal and migrant workers. Reminded that a lot of these workers, unfortunately, under vulnerability and under status of extrinsic vulnerability, I call it, it's if you're informal or you're migrant, because there are other vulnerabilities that are intrinsic within the person. If you're, for example, aging, or you're child labor, or if you're pregnant, but more of the extrinsic vulnerability, they can't. Sometimes they're not represented by they cannot be represented even if they want to, by what we call unions and other formal organizations. So in a lot of parts of the world, including New York City, we have what we call CBOs, which are community-based organization centers, who work with different populations, not public health, it's population health. In other words, for example, Adhikar here, they organize nail salon workers. They're usually, most of them are Nepalese, or a lot of them are Nepalese, for example, that work in nail salons. So, they organize them. Endalon is the National Day Labor Union. So they organize what we call in Spanish jornaleros, day laborers. I mean, they're standing on a corner waiting to work, and they don't know what their employer is going to be that same day, or tomorrow, or next week. And they organize these, a lot of the, and many others. We have Laundry Worker Center, and so forth. And we also work with unions per se. The point here is that we should create programs that embrace all types of workers, and especially those that don't have access to basic services, but contribute so much to the city, to the state, to the country, and to the world. So these are some of the publications that we've done with them. This is some of the things that we did with the Laundry Worker Center, and just for interest of time, I'm only going to put one or two there. Now, informality in New York City, it's part of society, and it's part of the world. You say, well, New York City, yeah, quote unquote, the capital of the world. Well, there's a lot of informality, and there's plenty. I mean, this is the same street in the 1900s, and this is the street a few months ago. So it's part of it circumscribes life, like I said in the beginning. And these workers, are workers. They're contributing to society. They're culturally contributing. They're contributing to the families in their neighborhoods, to their own families, and to the economy. I mean, the money moves around here, and people, buy, purchase, go when they earn their money, they go and deposit it on a bank, and they use haircut places. They go to the pharmacy. So it's part of the economy per se. And this is something that we need to understand, something that we need to acknowledge, and we need to offer the dignifying services for them to perform at their best. There are some initiatives around the city. For example, canners, their contribution to the environment part of New York City, and there's a lot of services and marketing and encouraging people to respect the canners and show them some love, for example, and how they contribute. And they have machines around the city where you can just deposit the one can or one plastic bottle, and then it drops a coin. So you just make their life easier, more dignifying. And there's also more I'm not going to say organized, but more city-driven initiatives, like, for example, under New York. So historically, New York has been known in different parts of the world. When you go into a subway or into a metro or into an underground, whatever it's called in your country, there's always artisans there, musicians, performers, and there's a whole movement about organizing them, and they don't get paid, but at least they get, a quote unquote organized area where they dignify their talent. With all this being said, we want to look into the future of decent work, and I'm just going to highlight the future of decent work is a whole presentation within itself, but it's important to highlight some of the publications under the leadership of Paul Schulte, and other colleagues around the world, and many of you know many of them or most of them. We did a first publication in 2022. Staging the framework with under the working group of decent work within ICO, and also Frida, that's also here in the call, demographic changes, and then we laid out some of the pillars, where include, of course, informality and migration. And we studied in depth how the elements or pillars of decent work affect or can be tackled or can be improved. And then we had a second publication in 2024 furthering the expanding of the role on occupational health and safety, which I encourage everybody to read as well. And at the end, informality and migrant workers, are part or embedded in the different domains of the United Nations where we're working on. And decent work, number 8, is basically what we want to aim mostly on. But it doesn't mean that we shouldn't work on the others. In fact, we should work synergistically among others. For example, reduce inequalities, gender equity, quality of education, no poverty. So basically, like I said at the beginning, work as a social determinant of health is basically embedded in most of these. This is just a picture back a few years ago in IOM, in the health sector, in the health section of the International Organization of Migration, where we signed a collaboration between the office and ICO. This is in Switzerland. Unfortunately, this office does not exist anymore, at least momentarily. And hopefully it comes back to life. And this is also the Global Coalition of Informal Work and Well-being in Marrakesh, when we had our first meeting, which is now a reality. I invite everybody to join. You'll be receiving a notification. And we have one vision, very simple, which is empower informal workers legally, dignify their work, and prevent occupational diseases and injuries to minimize workplace risk factors. And I want to end, and it's a perfect segue for my next presenter, to invite you to Cali, Colombia, Universidad del Valle, which Professor Fandiño is going to be our next speaker, where we're going to have the first conference on informal work, health, safety, and well-being. And I thank you very much.
Thank you very much, Akram. That's only convinced me even further of how active you are and well informed about this sector. Thank you very much. Well, we are running a little bit behind time now, so without further ado, I'll move on to Professor Carlos Andrés Fandino Lozada, who is a medical doctor and epidemiologist with a PhD in medical sciences from the Karolinska Institute in Sweden. That's a very well-known institute in Europe. He has been with the Department of Public Health at the School of Health of the Universidad del Valle in Colombia since 2010. He was initially appointed as an assistant professor, but became a full professor in last year, 2024. This year, he was appointed editor-in-chief of Colombia Medica, and he serves as the associate editor for Cambridge Prism's Global Mental Health. His career includes consultancy work for the Pan American Health Organization in Colombia's Ministry of Health in Bogota, and multiple academic collaborations, other collaborations within Latin America and Europe. He has been a recipient of the Distinguished Professor Award from the University del Valle, and several other prestigious scholarships and grants, including the Colombian Ministry of Sciences grant for academic interchange with the Universidad de Estadual, I hope I pronounced that right, from Rio de Janeiro in Brazil, Ercole European Union Scholarship for Doctoral Studies from the Karolinska Institute, the Col Futuro Foundation Scholarship for Doctoral Studies at the Karolinska Institute again, and he is a member of the Colombian Association of Epidemiology and the John Snow Society in London in the United Kingdom. He'll be talking to us on informal work as a social determinant of health. So I'm handing over to you, Andres, and welcome.
Okay, thank you very much. Thank you for your invitation. Thank you to SASOM for this invitation for this webinar. It's a pleasure to be here. I will share my slides. Please a moment. Okay, let me see. Okay, can you see my slides?
Yes.
Okay, perfect. Okay, my topic is informal work as a social determinant of health. Some of you have talked about some part of this framework and some consequences of informal work on health of the workers. The social determinant of health framework starts with the work of Dahlgren and Whitehead model in 1991. It's called also the rainbow of health equity because it organizes everything. It's as layers of an onion. We can see a figure in a moment. The important point here is the framework is for understanding how social, economic, and environmental conditions impact population health. Individuals' health is not simply the results of biological factors or personal choices, but also it's determined by the social context in which the people live. The conceptual framework has several layers. It's considering 5 layers of strata. We have the individual and constitutional factors, which are the personal characteristics such as age, sex, gender, and the genetic makeup. And also we have in the next layer, we have individual lifestyle factors. It's behaviors and habits of each person. And we also have the social and community networks. This is an important layer for social relationship and family relationships. Also, we have the living and working conditions. This is the next layer. This is very important for our topic because the work conditions and informal work are located into this layer. We can see here we have a set of services, social services like education, healthcare, clean water, sanitation, and also the working conditions. And unemployment and informal work is a very important determinant in this layer. And finally, is the general socioeconomic cultural environment environmental conditions is the outermost layer, and it represents the macro determinants of health. This include the country's economic, political, social structure, and other cultural issues in the societies. And also the environmental conditions, the general environmental conditions. Here we have the example. It's like layers. Also in Latin America, we call the onion model because it's like layers of an onion. And after these models, it was some kind of fixed model and to figure out the relationship between the layers and between factors. It's very difficult. And the Commission on Social Determinants of Health by Irwin and Solar in 2010, they propose a new model taking into account the relationships among different factors, among different social determinants of health. In this model, they propose structural determinants. These are the causes of health inequalities, and they refer to factors that stratify society and define the people's socioeconomic position. Here the socioeconomic position and differences in the power into the society is very important as a part of the model. We have the socioeconomic and political context. Also, we have the social position defined by social class, gender, ethnicity, race, educational level, occupation, and income. And here we have, in occupation, we have the type of work of the person. And for example, informal work is part of this condition here. And the intermediary determinants are factors from the social structure going to living conditions. And they have three and four. They correspond to layers number 3 and 4 of the previous model. And we have material circumstances, psychosocial factors, behavioral and biological factors, and the health system. It's not clear the proximal determinants in the model because from the previous model, it's supposed that the most proximal determinants are individuals' lifestyle and individuals' constitutional factors. But here they put their intermediate determinants, but something needs to be proximal. Maybe the reason is because some of the intermediate determinants are related with the relationship of the people with the society, with the family, with the society, with the places of work, and they locate as intermediate determinants. But a problem in the model is they don't have proximal determinants in itself. Here we have an example of a figure of the model. As you can see, it's more complex than the model before, because it highlights the different relationships among the factors. For example, the structural factors, the sociopolitical context, and proximal characteristics of people and environments. Here in the structural determinants, social determinants of health inequities. And here, the intermediate determinants, social determinants of health, most of them are personal characteristics and local characteristics. In the case of the work, is the characteristics of the work. And these factors have an effect on health being and well-being of people in community. Okay, and now we have the definition of informal work. Some of you during the webinar have addressed this topic, but very quickly, is an informal employment in non-regulated labor market. And taking into account the workers and also the employers. And it also included the self-employment as a part of informal work in the informal sector. It's dominant in informal economy, but also some work employment relationship with the formal sector could be considered informal work, because in some kind of works they don't have the social security coverage and other safety issues in relation with the formal work, and as a main characteristic. Informal employment is considered a precarious form of work. It's part of precarious work. This is a bigger category, but informal employment is considered a precarious work. Although in some research, in some studies, we can see that the relationship with health is not very clear. The relationship between informal work and some health status issues are not very clear. Also, from a very recent revision paper by Aronson and Witz, in some high-income countries, informal employment is referred to undeclared work, which focuses on intent to avoid taxes. Some people can do some during partial time, some kind of informal work, and the purpose is to avoid taxes. But it's not the main problem in the world as we have seen previously with the figures of the informal work. Following this approach, mainly in relation with employment and as a social determinant of health, the Employment Condition Knowledge Network, they did a final report in 2007. And they show this model is very related with the Irwin and Solar model of social determinants, but they emphasize here is Benash and co-workers. They emphasize here the relationship with work issues, with work factors. We can see here the employment. The employment framework. It's very important because it has the full employment with all the characteristics of the formal sector. People unemployed, they are not in the formal sector, but some people unemployed, they enter to the informal sector and they start to do informal work as a form of precarious employment. In the model, we can see here partially informal or fully informal according to the characteristic of each worker and each workplace, and it's considered a social determinant of health. Also, some reviews highlight slavery and child labor as an informal as a form of informal and precarious employment. But here in the definition of informal work is not illegal as an illegal activity. It's a legal it's an economic activity that could be legal, but is part of the informal sector. But here, slavery and child labor is something completely different because it's an illegal activity in most countries. And here we can see the relationship with the working conditions, this framework of the employment affects the working conditions, depends on the characteristics of the working conditions. Also, we have effects on health of the workers and also health of their families, and it's a determinant of health inequalities. The recent review by Aronson and Witz in 2025, this year, they create this new framework and they emphasize that informal employment is a health risk and it has a lot of health consequences, but the health consequences remain unclear. Some of you have talked about the main health consequences during this afternoon. The studies show inconsistency findings across different contexts and health outcomes. In some health outcomes, informal work it's very problematic, but in other health outcomes it's different. Some research links informal employment to poor health, including negative effects on self-rated health, mental health, injuries due to work accidents, and even mortality. Some reviews, ecological studies taking into account different countries. The mortality is strongly related with the percentage of informal work in each country. The higher the percentage, the higher the total mortality. But some results are inconclusive in relation to informal work. For example, sometimes the research shows no effect. Sometimes the research shows even a positive effect or protective. For example, in relation with some work injuries, informal work could be protective in some groups, and also in relation with mental health issues, and in the breastfeeding of worker children, it seems that it's related with the availability of the workers' time for the breastfeeding in some groups, but in other groups it shows a negative effect. And then the relationship between informal employment and health is complex. The research is very inconsistent in findings. Much of the variation is due to the different groups used for comparisons. For example, there are differences if the comparison groups with the informal workers is the formal workers, because sometimes when the comparison is with the unemployed people, informal work could be protected for some health problems, but it will be risk for other health problems. And also these mixed results emphasize the need to understand the specific conditions under which the informal work becomes harmful. Here we have a figure, a graph about the relationships between precarious work and informal work. Here we have the informal sector and formal sector. You have some lecturers have shown that informal sector is most prevalent in most countries. It's a bigger sector. And here we have the informal work. It's important to note that informal work could be part of formal sector also. It's most of the informal work, of course, is located in the informal sector, but some relationship with the workers inside the formal sector could be considered informal work also. This is important for statistics. And also here we have the precarious work, and the precarious work could be also inside the formal sector, but as definition and due to the work characteristics, most of the informal work or the informal work is part of the precarious work. And this is a question, I don't have the answer. Sorry. It could exist non-precarious informal work. According to previous review, because the findings are in relation to health are inconsistent, maybe this could be some group here, but maybe not. Maybe all informal work should be considered precarious work, and we will need more new frameworks of research for understanding these complex relationships. Maybe this little border here is related with the lack of data or of lack of a research approach. In this manner, Anderson and Huiwitz, they work with the conceptual framework as a multi-level approach to informality and health. It addresses a major gap in current research by moving beyond a simple direct link between informal employment and health, taking into account complex relationships, and additionally, some sociopolitical determinants of informal work are at the same time social determinants of health, making the relationships very complex. And then Aronson colleagues propose an analytic strategy to better understand the structural context of the social determinant that is socioeconomical and political, and they emphasize that it shapes the health consequences of informal work. The core idea is to analyze the level of regulation and protection available in each level. They propose 3-level: macro, meso, and micro. And they propose actions and also research taking into account different levels. It's very important to study specific groups of informal workers, because sometimes the health effects are very different, and the health effect depends on the kind of informal work. For example, women, the health effects could be related to some activities and not to others, and also with rural workers, vendors, and so on. And Dr. Salman Navarro, they talk a little bit about this, and it's how the relationships between the social determinants of health and work could be located. Could be placed inside the big model. In this manner, income and social level from informal work is related with the health of each worker and family, depending on the social position in the society. Also, in informal work, they lack enough social position and lacks of enough social support from an available network of social services and the relationships with the rest of the society, and it increased the vulnerability of the informal sector. In relation with education, the workers they tend to be less educated most of the time, and they don't have, and this could be affect also the health of the workers beyond the working conditions, and also the relationship could be affect the health of workers. And it's very important, employment and working conditions, because this is there is a low control of working conditions in informal work. And finally, social environments generate the presence of potential risks that can affect the health due to lack of job security. The physical environment, it's very risky in most of the informal work settings. They have low access to sanitation services, transportation routes, and they have higher exposure to toxics and environmental pollution in workplaces. In relation to personal health practices and adaptive skills, they adopt it's for informal workers, it's difficult to adopt healthy lifestyles. In relation to health services, due to the lack of coverage by social services, most of the informal workers they don't have access to most of the health services. Although in some countries there are healthcare services offered to all the population, but sometimes they have limitation, depends on the country. In relation to gender, it's clear that women they are exposed to more risk in the work environment, especially in some occupations. And in relation with the culture, they have less opportunities to be in contact with the rest of the culture and to receive good cultural goods and services. As conclusions, a significant gap exists in the literature regarding the interplay between micro-level, individual, and macro-level contextual factors that connect informal employment to health. The health effects of informality are highly dependent on the broader socioeconomic context. A new conceptual framework and research agenda is proposed by Aronson and Hurwitz, which is aimed at identifying the specific pathways that cause health differences across various settings and groups. The ultimate goal is to achieve a more holistic understanding of informal employment as a social determinant of health, which is essential for developing more efficient and effective policies to reduce health inequalities for informal workers. Thank you very much. In Spanish, muchas gracias.
Muchas gracias from me too, Andres. That was, I can see why you've won prizes for your presentation skills.
Thank you
What
very
we're
much.
going to do now, we're going to ask the presenters to come back who've presented this afternoon. Thank you. Akran's already back, and Christy presumably will come soon too. We've had three very different perspectives on what is, as Akran said, a global reality. And I think all will agree that this is not being particularly well managed at the current time. And there's certainly a lot of room for improvement. Thank you very much for the nice examples that have been given of where people have tried to work and how they're trying to work to improve the health of these people. One thing that came across to me in all three is the lack of really basic things like access to toilets, to drink clean drinking water, and you know, that form the basis of healthy living, food, decent food. I would like to know, firstly, I presume you listened to each other's presentations before I go on to telling you what Q&As have come in. Are there any questions that you would like to ask each other from the presentation? I saw, Christy, that you made a comment at one stage. Do you have any comments for each other or questions? Akran, if you're talking, we can't hear you.
Yeah, no, I actually want to just make a comment about, how good of presentations both Carlos and Christy made, first of all. And I do have maybe a curiosity question for Christy. Yeah, so how with regards to the groundwork, I think we spoke about this before. I just want to highlight it in the webinar. How much is WeGo engaging with workers' voice as to their actual contribution to improving their working conditions and their health? How much of their input is used and valuably to improve their working conditions?
Thank you, Akran. And also thank you, Andres, as well. Really, really interesting presentations. And it's an interesting point on workers' voice, because the reality is that workers in the informal economy are essentially excluded from many policy spaces. So where all of these conversations, critical conversations happen at national level, even at municipal level, and of course at global level, it is extremely rare to have the voices of workers in the informal economy projected in those spaces. And that's precisely why WeGo exists, in fact, because for almost 30 years, as we've existed as an organization and a network to help workers to build their power, to sort of try to help them visualize their struggles and really try to open up space in some of these policy spaces for workers themselves to represent themselves and talk about their issues, not us talking on behalf of them. So yeah, I would say that participation in these critical spaces is a really fundamental thing. And actually we're seeing that particularly with a major project that we're doing at the moment in Brazil, where participation is the #1 priority of workers of multiple sectors. And yeah, it takes a lot of work.
I think it's probably also important to get the local authorities involved so that they know what's going on and what you're trying to do, and maybe increases their awareness as well. I presume you'd agree with that too, Professor Losada. Andres, please turn your speakers on so that we can talk more freely.
Okay. Yes, and in relation with Christie's presentation, I have a question about the definition of informal work, or definition of informality, because there is a lot of controversies, and it seems that the group of Benash, they define as any informal activity should be considered precarious. But there are a lot of controversy. What other definitions of informality do you have?
Yeah, it's interesting, isn't it? So I think the most sort of referenced definition, a broad definition of informality, relates to, someone who works without social protections and social security measures. So whether that's, pensions and social health insurance and things like that. So by that definition, and of course there's lots of nuances that needs to be considered, but by that definition, which is a definition that's utilized by many, including economists and social policy people, by that definition, someone who is a consultant at a accounting firm who earns, I don't know, $300,000 a year, but doesn't necessarily have the formal social protections, could essentially be seen by some as being an informal worker. Now, we know in this room that that's clearly not who we're talking about in this discussion, but just to say that by using that definition, which is often cited, technically you could be talking about someone like that, and that kind of person isn't living or working in a precarious situation because they have a very high salary, and if they got ill, they'll be okay. They'll be able to access very high quality private healthcare depending on the country, or travel in order to get out of the country to find that. So yeah, but how at least at WeGo, how we've viewed informality, and I am actually not the expert on this, but there are some of my colleagues within WeGo who really could articulate this better than I ever could. Still the vast, those who work in the informal economy do tend to be extremely precarious. It's just a reality, and I think that we know who we're talking about, essentially, or who we should be talking about.
Okay, thank you very much.
That's a good. I want to add something. That's a good question, Andres, that you just made, and your answer, Christy. So, yeah. So one of the things we want to do with the Global Coalition is actually, try to understand the different definitions, semantics, and how are they all used. For example, the word precarious itself. If you study the word precarious, on definitions in different languages can mean different things. If you say precarious, you mean kind of like instability, or not having something stable that would lead to poverty or would lead to something bad, technically, right? So, but in some literatures, or if you translate it in other languages, when you speak about precarious, you speak about the working conditions. That's something that's dangerous, dirty, and something quote unquote precarious, which is not really what it's meant for. So, but it doesn't mean that the working conditions are not important. But the word precarious is vastly used. So, so going back to what's informal and what's informality, I think that's an ongoing discussion that we're obviously not going to solve here. But it's a dynamic discussion, because with the new forms of work, things are popping up that that we never knew or even dream of existing. Gig workers, platform workers, individual workers, and so forth. The whole tug of war of, are you employed by a company or you're just the user of a technology app? Just that question, brings a whole wealth of studies. So I'll stop there.
I want to move on anyway to the two questions that we have in the Q&A. If anybody else has questions, please put them in the Q&A. We'll try and find time to get to them. But the first one is specifically directed to you, Andres. But it says, the speakers have presented slides showing models to illustrate this topic. Models are often inaccurate. We certainly all agree with that. But could you comment on the merits of research by doing, in the way that Andrew Thatcher discussed when investigating the Warwick Junction earlier on? I hope that you heard it.
Okay, from a research perspective, I think that models are very useful to understand a phenomena, and in the review of Anderson and Which they propose a model for for quantitative approach in research, and they say that the qualitative approach of the research is not covered by the model, and they intend to organize factors as variables that could be used in research, and that's why I was talking about if a concept as non-precarious informal work exists, but it seems that informal work it's always negative for the health of people, because some research focus on only one problem, but the research is not addressing other problems. For example, one research is related with pain as a musculoskeletal disorder, but that research is not intended to research mental health, and the informal work could affect both, but the research is not covering very well the approach, and that's why the model is very important. Sometimes, of course, the models could fail, but it's a guide that the researchers have.
I was very interested in your presentation when you said that there are some studies that show that informal work can be positive in some circumstances, and there are certainly circumstances in my home country in Switzerland where people
I think that
specifically choose informal.
For example, in some of the studies in the review, they show that women, informal workers, they have more time for breastfeeding, but because maybe they are urban informal workers, but for example, in another setting, rural informal workers, they are very in the distance between the workplace and the house is very long, and women, they don't have enough time for breastfeeding, and the model it's intended to understand the specific situation of each worker, and that's why some of the results are very contradictory. And also, for example, in relation to work injuries, unemployed people, they don't suffer work injuries because they are unemployed. People in informal work, they suffer work injuries, and if we are using unemployed as the comparison group, the effect of the work will be negative. All depends on the comparison group, and the model. It's trying to understand these complex relationships.
That could be a little bit the healthy worker effect too, that people who have had a serious health compromise are no longer in the workforce, so they don't get counted when the statisticians come along. But anyway, there's one more question here that I'd like to get to, because it's probably a very important one for us all. How could funding be obtained from the 1% of the world who have most of the wealth?
I'm not going to answer that one, but I want to actually answer the last question, the last comment, and it can segue to this question. So another form of, or another example of how informality can be positive is when informal work and culturally driven and artisan type of work is the actual asset. It's the actual impact in the product that's being manufactured, for example. If you have manual labor that is usually informal work, but the end product, it's so precious that it's highly sought after, and it's actually very expensive, but unfortunately has been informal in the sense of the protection of the worker per se. So maybe the discussion is how can we, and the question comes, where is formalizing informal the solution? That's one of the questions that we're trying to answer and look at. It depends. Because if you go, for example, to a tuna factory where it's not manufactured on industrial numbers, but it's actually done manually in a manual way, and that's what it gives it the importance, it can actually be an asset that can be sold better for and maybe that catch the eye to that 1% that has the money to fund informal work. So they say, well, I mean, you know, I'm a billionaire. I might be interested in this product that the actual informality way of doing it or the actual artisan way of doing it, it's what makes it impactful. But I might want to invest in their social protection or their healthcare or their preventive measures and sort of. This is, I mean, we're just starting to talk about this in many ways. So that's one of my ideas.
Does any Andres?
But in this case, the handcraft informal worker, they don't have access of the healthcare because the informal sector are not covered by the health insurance. And if this artist, if she has, for example, a chronic disease, she will have a health problem in the long term, no? And that's another important issue because it's important to provide to informal workers of access to the healthcare because if they are affected by a chronic disease, it will be very problematic in the future. That's the negative part.
Yeah, absolutely, and that's what we've been talking here all during the webinar, but I was trying to respond a little bit to what Kevin. I don't see his question anymore. Kevin Renton is, maybe it might be a good initiative when we don't have those healthcare provisions for informal works. Maybe that would be a philanthropic approach in a sense.
I suspect that the answer to that question is probably as diverse as informal work is in the world. There are some people who have, as you said, are quite philanthropic and are willing to give money to good projects. And there are many organizations that do that. There are, of course, others who contribute to the problem more than they than they donate. But so we have to find ways and means of getting the funding to the problems and the issues where it's needed. And particularly, I think the main thing, as you've all pointed out, is to make the social change and support the political change to help the situation. I'm just wondering whether Dr. Jeffrey Tafune is waiting for us or whether yes, he's got an invitation, I think, to come online because he wants to wrap up the discussion. Thank you all very much. Muchas gracias, Andres. And yeah, it was lovely to talk to you all.
Thank you, Maggie, to you for chairing this session. Thank you so much.
Thank you.
Thank you very much.
All right. Thank you, Maggie, for doing a sterling job to moderate this. I usually call this the graveyard hour, but there was so much exciting presentations that we remained glued onto our screens. Thanks for a job well done. So my job is quite simple at this stage. Is just to give the vote of thanks and to wrap up the occasion. So I want to extend a huge vote of thanks to all our esteemed presenters, panelists, and moderators who did a sterling job in preparing and delivering today's SASON second webinar for this year. I know a lot of the work is in the preparation. When we cut to the summaries now, it's now to deliver the icing on top. Given the number of attendees who opted to stay logged in for this long 4-hour session, I can safely say it was a resounding success. The session was tailored for occupational health practitioners, academics, and diverse policymakers dedicated to promoting health equity for our vulnerable workers. And I think we did a good job in highlighting the dark corner where those vulnerable employees without socially, but now we're saying now is the time to elevate their status, to elevate their visibility, and for different policymakers to consciously try to say, if this is 60% of our workforce, we can no longer afford to keep ignoring them. It's a big issue, clearly. Thank you so much for all your contributions and discussions that you ignited. We're hoping to invite you to our International SASOM conference in December, in November, in mid-November of this year. And we will share through the invitations via emails and all the social media platforms. Thank you so much and enjoy the rest of your Friday to everyone. Thank you.
Thank you.
Thank you, everyone.
Thank you, everybody. Bye-bye.